doing in LA. It means so much. And I've really enjoyed working with you and hope our paths cross in the future.
Anybody else? Shayna?
Yeah, I just wanted to add, so it has been a pleasure to work with you. And I think, Muntu, you bring this sort of unique combination of head and heart to the work, and consistently remind us, I think to George's point about, the values that need to be driving this work. And as we sort of dug into conversations about equity, you reminded us what that really meant. And how that needed to ground all of this. So really, thank you for everything that you've done.
Okay. Well, other than George and Muntu, the commission has changed since the two of them started. All of these are different commissioners than we started with. So I know also on behalf of former commissioners, they would want to send their best wishes as well.
Absolutely.
So
not many people go through 2 full 4-year terms on the commission, and we get a lot of turnover, and we've had a lot of excellent commissioners. And I think, well, a couple will make quick comments, and I'll come back to that. Before going to the next stage, I'm going to make a couple comments, couple opening comments, and a little bit from an historical perspective.
George,
Back
do we
when I
want to
first
let
got...
Muntu say something before we move
Oh,
on?
Muntu, would you like to say something, please?
Sure. No, thank you. And I appreciate everyone for your kind words. When I first started, George, I don't know if you remember that first meeting. It's one of my first times being on a large, state commission like this. And the first meeting we had, there was media. And there was media for George. And George had a bodyguard at that time. And so we walked into this with a lot of drama, but we focused in on the work. And that has been what this commission has done through all of the different things that have come our way. And I've enjoyed working with each and every one of you and the perspective that you bring, as well as the staff over time, and the nimbleness and thoughtfulness that you all have brought to this work has made it easy for me to participate. My only regrets is that, over the last few months, half a year, that I haven't been able to be, as active. But I can see and I continue to follow the work, and you guys are doing a fabulous job. And I'm very proud of the work that we've done and the work that you guys are continuing to do moving forward. I will always be here for you guys if you need something. I'll still pay attention to the work, as well as with our local commission here, and really have appreciated all of you as we've worked together to try to improve what we see for the kids in California. So thank you. And Camille, I did get the gift. It was very lovely. My wife loved it. So you guys got 2 thumbs up from her as well on that one. So thank you very much to all of you.
Wonderful. Okay. Thank you, George. Go.
Excellent. Yes, wonderful. Looking back, back to kind of those early days when we had those very first meetings. One of the things that, one of the reasons Governor Brown had asked me to come on the first 5 commission was the commission had been relatively low impact at the legislature. In fact, had not taken stands on any issues for a while, and kind of wanted a voice from the earliest childhood perspective in that setting. And I had done a lot of work in putting together various kinds of coalitions, and I had set up the Early Childhood Committee for the city of San Francisco and the Bay Area Council, and had been in that space. And I'd worked on Obamacare, and I'd worked on Minnesota or California Care, and actually even Minnesota Care got. And so I had a lot of very, very high level active involvement in that space. And one of the things I've done as CEO in 7 different places is I've set a lot of goals. And what I find is if you set a goal and it's a clear goal, And it's a meaningful goal that it points people in the direction, and it points people in a direction together in an aligned way. And when you get people moving in an aligned way, you get much better outcomes. And goal setting, I think, is incredibly important. And the goals you set identify what your values are. They identify what your direction is. They identify where people should be spending their time. And people have to make decisions every day in the context of their everyday life. And when they're making those decisions, if they know what your values are and what your goals are, the combination of values and goals can point people into individual decision-making in any setting. So I found that useful in multiple settings, trade associations, companies, health systems, whatever. It's a good model. Got to first five, looked to see what kinds of goals would make sense here. And I was told that initially the first five didn't do goals, first five did budgets, but not goals. And I thought, well, I'm going to have a really hard time not getting more focused than that. And so we set some goals. And the first goal we set, I'm going to really quickly go over them. But the first of the five goals we set at 90% was to go from not being heard on legislative issues to being heard on 90% or more of legislative issues. So we decided to flip it entirely over. The first five association was totally on board, supportive with that agenda. We put together kind of a collaborative, but I went to the legislature. I spent a lot of time. I met with the speaker and the pro tem and the committee chairs, and I met with the Women's Caucus, and I met with all the various organizations at the legislature, and I gave them usually my book, my 3Q-year book. And gave that to them and their staff, and then lobbied them on brain development because we needed them to know how important brain development was in the first years of life, because they didn't know it. They literally had no clue. They all thought that everything started at kindergarten. They were in kind of a K-12 education model. And by the time we finished all of those meetings, they had converted, and they now understood that the first couple of years were really important. And I spent a lot of time lobbying initially. Then I have not spent much time at all. And Camille's been brilliant in supporting that and doing all the right things in that agenda. I have not, the last year, 2 years, I haven't had to go to the legislature at all, because we've had such good staff doing it, and we've got such a good alliance doing it, that we are now heard on bill after bill, and we're getting some passed, and there are bills passed with our name on it. You all the commissioners here are the reports at the meeting, but we are now a force at the legislature in those settings. So I think that first goal was achieved. Second goal, second 90% goal, we did some work at the beginning of the time. We discovered that 90% of the mothers in California, low-income mothers in California, did not know they could exercise their kids' brain, strengthen the brain. Literally did not know it. And so when we asked what happens, they basically, the overwhelming majority believed that whatever level of intelligence you were born with, those were the cards you played for life. And when the overwhelming majority believes that, then that particular set of mother in those directions, and all the mothers love their children, all the families love their children, everybody wants their kids to do really well. And so everybody loves learning that you can actually make a difference in those spaces, in those ways, and it's a loving, collaborative thing to do. So we identified that 90% did not know it. And we shared that with the superintendent of schools, Tom Torlakson, and we shared that with Diana Dooley. And they both said they would like to support us. And Torlakson realized that the schools were all failing. Learning gaps at 15 were not closing because we weren't getting the gaps closed at age 15. So he came on board. So we had one of our first 5 summits where we brought people together. And again, that was part of the collaborative process. Let's do regular summits and make those meaningful to the folks. And Tom Torlakson and Diana Dooley stood next to me and Camille. And they basically said they were committed to flipping that 90% over and providing information through Medicaid, through the schools. And so Tarleton set me up with all kinds of meetings with school superintendents, and that whole agenda, we got that out there to give them a better chance. And then we did the first 5 ads, Talk, Read, Sing ads. And the ads were really, really incredibly tightly focused on that issue. And advertising people like to do new and interesting and challenging and different things, and they like to change direction a lot. And what we've done with that is keep them from changing direction, because we need every kids being born in California, we need those parents to know that Talk, Read, Sing is the right thing. So we wanted that to be 90%, and we got there. We're like 87% on the most recent state survey recognized the Talk, Read, Sing ad. So it's not a perfect 90% understanding neuroscience, but it is 87% understanding the Talk, Read, Sing makes a lot of sense for the kids and is the right direction to go. So that was a success. We also knew that, and we did several studies knowing that the next stage after 90% reading or 90% learning was 90% reading. We couldn't get to 90% reading. And the reason we couldn't get to 90% reading was over half the low-income homes don't have a single book. So we worked with First 5 of LA, brilliant program. Little by Little is a great program. It goes into the WIC sites. WIC is a perfect, we talked to every commissioners who were on the commission during this time, heard the WIC presentations and heard the WIC team present in that process. But the WIC people were incredibly, or the Little by Little people were incredibly good because they went to the WIC sites, highly credible, and they actually got the books distributed to the kids, low-income kids, in a really good way. So that program went really well. I talked to Gavin Newsom about that when he was running for governor. He loved it, said that he would support it strongly when he became governor. And I was just doing a fundraising call on the current campaign, and one of the people chairing the call said, "You must be really happy, George, with Governor Newsom," because he said, "I did many fundraising meetings with him, and one of his 3 points at every meeting was brain development in young children, and how he was going to be transformational in getting the young kids of California to be." And the guy said, "You must be really happy." And I said, "You know what? He's totally could not be more on board. He's totally supportive of that agenda." And I didn't tell him that we didn't get the books, but with Governor Newsom, I did talk to him about a couple times, told him that Little by Little was, and we did that kind of from our perspective, both of having running multiple companies and knowing that you need to focus on tools that work and you need to focus on programs that create functionality. So I'm letting him down, and I'm going to write a letter of apology, actually. But we almost got it. We had it in the budget. We had it in the process. We had it in the funding. We had the Little by Little program ready to go. We were so close. And then COVID hit, and COVID is damaging everything. And COVID is just hurting all kinds of spending. And COVID kept that program from going where it could go. And because COVID has kept that program from going there, there's all those kids in all those homes who would be so much better off if there were books in those homes. Because one of the things the books do is they feed the interaction that kids really need. And the serve and return interactions are facilitated, supported by books. And you don't have to teach serve and return when you get the book in the home, and the book itself teaches serve and return. And so there's a great thing. So anyway, that one didn't happen. My fourth goal, 90% goal, was to have 90% of the people on this commission being interviewed when the annual Learning Gap story happens in California every year. And the goal was to have the members of the commission interviewed at that point, explaining to the media what First 5 was doing to make those learning gaps go away in the future. Those gaps have been there for 30 years. They're ugly, they're nasty. They haven't closed. And the reason they haven't closed is they keep trying to close them at 15 years and not 15 months. And so I thought we would go down that path, and we started that work, and I had some of the commissioners doing some media. At Kaiser Permanente, I went from having a couple thousand positive media references to having over 20,000 and every year. And I did that by having really smart people from Kaiser Permanente, the regional presidents, the medical directors, the medical department heads, all doing media contacts. And you get so much credibility from having that level of broad exposure. And it would have made no sense for me as chair of the commission to get that visibility. And if you notice, I've stayed out of commission visibility pretty much, but it would make huge sense for our other commissioners to get that. And this is a really good commission, really smart people, brilliant people, really good, high achieving people, articulate. It's great. I'm throwing bouquets in your direction, but well deserved. I mean, this is a very, and Mantu's with me from the beginning. I don't think there's ever been a stronger commission for First Five California than the one that sits in place right now. And this commission has the ability, I think, to do really great and positive things going forward. And so that'll be a great thing to do. But the goal was to have, when that learning gap story hit, 90% of the learning gap stories have a positive bouquet in that mentions First Five and says First Five is doing these things to help make that gap close. So there was a fifth goal, and then I'll stop talking about that. But the fifth goal was we channel a lot of people to the website. The website we had was relatively mediocre. We pushed a lot of people down that path, and when they got there, most of them didn't come back. And I've worked on the Kaiser website. That's incredibly successful website. It's used kind of a model. I worked on the Mayo website. I'm on the Mayo Clinic board. I was on the communications group there, but I worked on the Mayo Clinic board and did a lot of work. The Mayo website gets millions and millions and millions of users because of the way it interacts. And my sense is that First Five website ought to be in that category. That ought to be in the category of being an absolutely great website. And it's really, really hard to do that in the context of a state agency, because you've got timeframes, you've got issues, you've got all of the approvals. This is not an easy thing to do. As the communications committee, we actually did deep dives into that space. I brought them in and showed them some of the best websites that existed, shared learning with some of the great websites, and we did some really good work. And I love where the website is now. I think we've made great progress, and I think we're going to get 90% return on that website. And I think the Medicaid program is going to be able to use it in COVID times, even to get all the mothers. So if we can get all of the new mothers, new parents to the First Five website, and then continues to improve that website. So I will sort of end my talk with saying that we need to go forward now and set some goals. And Chris, I'm calling on you to do this, because we need literacy goals for California. We need learning gap goals for California. And the master plan, as it is being built, will fail. It will spend a lot of money. It'll spend a lot of money, but it will fall far short of closing the earning gaps or the wealth gaps or any of the prejudice gaps, because there's nothing in that plan as it sits now. If they work on literacy, and if we came forward now and called on everybody to get books to the kids and to do basic literacy things, everybody would be on board. The librarian's on board, the superintendent of schools is on board. We have a huge amount of public goodwill that we could go on board, and we need to set that goal. And then we need to do some basic measurement. And when we, years and years and years ago, diabetes care in this country was terrible. diabetes care. The diabetes was the #1 cause of blindness. It was the #1 cause of amputations. The diabetic care was inconsistent. Rich people had good diabetic care. Other people didn't have good diabetic care at all. And we took a look and we discovered at that point in time that the majority of the patients weren't even having their blood sugar measured. And so we didn't want to put care protocols together on best care, but we needed to start people down the right direction. So we started people down the direction of measuring blood sugar. And we set the goal of having 80% of the patients in America that had diabetes have the blood sugar measured at least annually. And we moved in that direction. And when we did that, that was the basis for a whole bunch of other really good things in diabetic care. And they got better at diabetic care at multiple levels, but we couldn't have started with best diabetic care and tried to drop that in everywhere because it would be too complex and have too many moving parts to work. But we did start with 80% and we moved up, and then we created some other standards. We did some follow-up over time. And we are now at the point where it is not the #1 cause of blindness, and we now have much better care. We need to that in books. We need to have 80% of all the low-income families have books. We need everybody on board with that goal. We need to make that happen. And then we need to have 80% of those kids just with a couple of basic things, know the alphabet, count to 20. I mean, they don't have to have great stuff, but they've got to start somewhere. And so I'm asking Chris, please include literacy in the, and I just read the last set of slides again, and there's not even a mention of books for literacy in it. And I know you're thinking about it, but I'm pleading with you to get beyond thinking about it and do it. Incorporate it, make the next, and I know the governor would like that. If it doesn't happen, I personally will be very, very, very clear about how fall short that plan will be for meeting the needs of the children of California, even if the rest of the parts are good. If that part fails, the kids will not be able to read. And when you want to close earning gaps, you're not going to close them with kids who can't read. It's just not going to happen. We got to close the earning gap with kids who can read. So I'm going to stop with that as my last point, my plea. I may come back to it a little later in the agenda. And I'm going to turn the chair back to, or Camille's going to give a quick overview on how the virtual meeting will work. And then I'm going to read the conflict of interest for the commission, and then I'm going to ask the public comment. But Camille, you want to explain the process, and then I will go to the conflict of interest.
Thanks, George. I think we're all good at this now as far as public comment, or I mean, as far as participating in the virtual meetings. For those of you who are watching us live, if you have a comment on one of the items, if you'll please raise the chat hand on your Zoom, we will recognize you and call out your name, and then make it so the magic will happen, and we commissioners will be able to hear your comments. Commissioners, you have this protocol down so well, people talking one at a time and not over each other, and raising your hands or just signaling to us that you would like to comment. So I don't think we have to go on forever about this because now we're experts. So anyway, back to that, George. Conflict of interest, please.
Conflict of interest. Please let me know now if any agenda item presents or potentially may present a conflict of interest for you. Obtaining this information in advance will ensure that I can announce your non-participation in any aspect of that item in compliance with applicable laws. Does that apply to any member of the commission, to any topic on today's agenda? See motion, but I'm not hearing anything.
Nope, I don't think anybody's raising their hand.
No one is raising their hand. All right, well, that moves us to reports. So we are, the public is welcome to and invited to offer public comment and And that will be up to 3 minutes per comment, but I will come back with a formal announcement on it later. Camille, let me turn the agenda over to you for the first report.
Okay. Well, good morning, commissioners. It's so nice to see you. We've added sleeves. It's getting a touch cooler here in Sacramento, not much, but a little bit. So I'm pretending it's fall, if nothing else. So happy to see you all here. You know, when we went home, when we went home now 8 months ago, and people started teleworking from home, I think we all went home with the thought that, you know what, in a couple of weeks, we'll be back. So this is kind of novel. We're going to go home and, you know, that'll be fun and all of that. But we never imagined that 8 months later, we would still be doing virtual meetings with all of you, that we would, for the most part, every day. It's a pretty empty office here because people are still teleworking and working from home. But to that point, our Zoom skills have really improved since we started. You know, we're getting the hang of it and doing that pretty well. We've learned to use quote a Teams application, and people so we've learned new platforms. We've learned more technology than some of us have wanted to be truthful, but we have. You know, we've interviewed and hired some folks without ever meeting them in person, which is novel, but we have. And most of all, I think we've learned to be a little more patient for a response, knowing that everybody's mailboxes are stuffed beyond, that phones are full, that everybody is really, no matter what position they sit in or what job they're in, are working very, very hard to make all of this work. And I think we're doing a good job of it. But there are some things we miss, you know, really. And there are some benefits to working here in the office versus working at home, at least for me. So, but I've heard it from others. We all miss each other. We miss that camaraderie that you don't get from a screen. You know, that you can pop in and bring together 2 or 3 people and have a discussion and have some thought partners without saying scheduling it or doing, you know, so we miss that. But certainly, and Chris might remember, we miss the potlucks. We're good at potlucks. We miss getting together and sharing a meal and talking about our lives outside of this place. And we miss seeing people in more than one dimension, you know, the flat screen. So, but we talk about it a lot. We talk about ways to keep our cohesiveness and keep our everybody not only focused on our mission. That's not hard to do. People love our mission who work here. They really do. But how do we keep each other bolstered? And so the staff thinks about different ways to do that and continues to do that. But overall and on balance, I think we're hanging in there like everybody else and getting through this time. Couple of things. One is you have some, for the first time, you have some attachments with this item. And the first one is a personnel update. So at the request of Commissioner Hazen at the last meeting, she asked us if we could put something in writing which we have, kind of a personnel report. So we plan on giving this to you at every quarterly meeting. And really what it does is just reflect new hires, promotions, resignations, retirements, and maybe any other pertinent personnel information. So it's there for you to look at. That again will be included from now on in the information that we send to you. But today, Shana?
Shana?
And the one thing I'm wondering if we could include moving forward, and I don't think it's in here, are vacancies, like how many open positions are
Sure.
there?
Happy to do that.
Thank you.
Okay. All right. So we'll include that going forward. Couple of highlights that are on your sheet, but just to say out loud, Rick Espinosa has recently been hired as an associate governmental program analyst in our contracts and procurement office. You know, he most recently worked as a contracts analyst with Caltrans and also has experience with the Agricultural Labor Relations Board. You know, good guy. We saw him one day. I saw him one day after he'd been hired, and I haven't seen him since. But from emails and stuff, he's working hard. We're really glad he's here and has joined us. You've been getting emails from Simone, who is right here. There she is, who is now recently been promoted to a staff service analyst. And I want to say her responsibility is taking care of all of you. That's one of the big ones, and making sure you have information, making sure that, you know, if we ever travel again, she's going to make sure that you all have what you need to get here. She's also doing some fiscal and administrative analyst work for several of our programs. Previously was the office technician. We think she's just ready for this new work and responsibility, and really glad. The last one on the list is really, we are now contracting through the First Five Association for some of John Sims's time. So John Sims, who was the interim executive director of First Five Association, is now on board with us part-time. And he really is helping me on a variety of projects, really across the board, everything from small counties to parent kits to just about everything. And so it's great. It's a fresh pair of eyes. So it's already been really valuable to us. So again, it's part-time, but we're really glad he's here. I know some of you have asked me about the replacement for the Deputy Director for External Affairs. We've gone through yet another set of interviews and have some good qualified candidates that we are now in the process of trying to close some deals. We'll see if we get there, but we have been working hard to find someone to do that. So that is the other one that is on full board. So we're looking, and we'll keep reporting, but that's our personnel report. Any other questions about that before I go on? Okay, so we also wanted to give you a little bit of an update, and actually Simon's going to help me with some slides. We even have slides, so like we're really moving along here, about supplies and where we are with our getting supplies out. So we're going to give you a brief update on the current status of our emergency supplies contract. As you'll recall, with supplybank.org. We've been working closely with them and with Benito Delgado Olson, who you've all met and heard over the years, to really effectively and efficiently provide critical supplies to all 58 counties to support early learning and care providers and children and families who are grappling with COVID, and most recently with the wildfires. We've expanded to make sure that those affected by wildfires are also getting what they need. In the recent weeks, we've been working with Supply Bank and the association to support counties during this catastrophic, as I said, fire season in order to get them what they need. You can see on the slide, these are the counties that we've connected with. I just talked to Siskiyou yesterday, and she told me she's never felt more supported by the folks at Supply Bank. Yes, Shana.
Do you mind just giving us a quick reminder of what the investment was and the time period by which we wanted to distribute the dollars?
So $5 million, it's a $5 million investment. We did it twice. We started with 2 million. We started with 4. Sorry, Simon, right here. We started with 4 million and then added 1 more. So the original investment, or the original action taken by the commission was for $4 million. We came back and added 1 million, and the timeline is through December of this year.
And we approved that, was that in April? So was it April through December? And then what is the time for the data that you're sharing? When did it start? So I see it's through October 10th, but all of these items began.
March, the data is March through October.
Yeah.
The first one was in March through October. And so I think we started, I want to say February. And Chris might even remember this. Remember, this was an outcome. We started working with, Chris had called us all together, not just First Five, but Department of Ed and others, to talk about how we could help, all of us could help with supplies, especially in the beginning of COVID. And so this was kind of a result of some of that work, is us putting this together. Does that help?
Okay. Yeah, that's really helpful. And then, yeah, no, that's helpful. Thank you.
Okay.
And I would also just add that I think the request was the second time was for more money, but we approved $1 million because we wanted to sort of see what the new changes might be to make sure that how we were investing the money for emergency for COVID was relevant based on the time. So we approved the 1 million.
Yeah.
And
Okay.
for comment, Camille, you just sent these to all of us. This was a brilliant, brilliant thing to do, to get into the essential worker homes thermometers. Because the essential workers, not only for the kids, but for the homes. And I think we just saw, you just mailed these to or you are this week, they're coming.
They should,
Anyway, they're
you all
really
should
well
either
done.
have them.
Extremely good.
Yeah. You
Well
all should
done
have them by
device.
now.
Thanks for doing that. And it's a perfect, and I've talked to a couple of people outside of California about putting those thermometers into the homes of essential workers, and they all think it's brilliant. For all the reasons that you would think they would think it's brilliant. So well done.
Thank you. So here's a graphic that we put together that kind of shows what's out there and what we've done so far. I think if you look back, Simon, go one back on what we put out. For the first time, we put out formula during folks who were unfortunately their counties were part of the fires. They asked for formula specifically, so we did include that this time for them. So and we continue to check to see where and what people need, and so we're doing pretty well that way. So additionally, you know, as I said, when counties identify, one of the things they did identify was the touchless thermometers. And so we are still getting those out. And by hopefully through early November, they'll all be distributed. And finally, we wanted to just share a couple of highlights of the work being done locally. So Simon, there you are in First Five Santa Barbara. You can see folks doing the work, pointing the way, and also some of the news that we've gotten. There's Katie Porter in Orange County doing some work with us, and that's great. San Joaquin, lots there. You know, going out. So you really can, all up and down the state, different places, different people getting supplies. So that really, I think, makes it real. You know, you really see that's happening and really making a difference for kids. And so we have two events this week, one in Humboldt and the other in Fresno. where we're again going to be set up with some coverage of those. So we'll be sharing those with you as well. So we continue. The other is, as you'll recall, we talked to you about reimbursement from the federal government. So we are in the queue. The way that works is we have to expend all of our funding before we will get reimbursed, but we filled out the paperwork, and as we move along, we'll send them that form. So our have no reason to believe we won't be reimbursed. So hopefully, knock on wood, that happens. Any questions about supplies? Okay.
Yeah, one more quick one. So first of all, this is amazing, obviously, logistical undertaking, and exciting to see just the sheer volume of what's gone out across the state. In terms of, so you said we're constantly checking in to see, you know, what the needs are and that the needs are changing. Can you just speak a little bit to what that process looks like and how in real time we're continuing to collect that data and provide what counties need?
Sure, that's right. Right, with partnering with the association and Supply Bank, we periodically survey counties to say, you know, what do you continue to need these supplies? How's that working? Supplybank.org works very closely with the counties as those results are come in, and we look at, yes, there's still a need for diapers or wipes. That during the fires, I noticed in some of the survey information that came back, like diapers were kind of at a lull for a while, but now that with the fires, there was a real increase in the asking for diapers and wipes, cleaning supply, you know, so we're trying to periodically check in.
Okay, and then the last one, and I know we don't want to spend too much time on this, but I think in terms of then sharing out this data, so this is obviously not our traditional role, right, to be the provider of these emergency response supplies. But clearly there is a need, and part of me wonders, like, is this need sort of beyond COVID? COVID exacerbated it, and the fires did as well. But I'm wondering, how are we communicating this information to the more traditional sort of government providers of these items to make sure that, you know, we don't have to continue doing this moving forward?
Right.
I mean, I don't know that I think it was important that we do it now. I don't know that it is sort of the right lane for us to stay in.
Forever. Yes. So we continue to work with Department of Ed and others who we know are, we check in on the health services side where people are supplying with emergency services, the Office of Emergency Services, to see what's out there. I thought, if I remember correctly, the commission had said if when we invested this money, should we get reimbursed, we would use it to continue, like we wouldn't come back, but we would continue to use that funding. We have had discussions, Shana, about a life beyond COVID. So what is it, you know, and how, and do we continue to have available to us the ability to supply emergency supplies in the future? So we are kind of talking about pros and cons of that, but right now continue, I think, still to be in the COVID wildfire lane, and people are still requiring those items to help them during that time.
This is still a crisis time. This would not be a good long-term use of First Five money in stable and normal times. But in crisis, when there's an emergency and there's no alternative way of getting there, it makes sense to be a short-term use of the money. But voters didn't set First Five up to provide diapers. And First Five was set up to close the learning gaps of California and to give kids a right start at all levels. And diapers are supportive of that, but are not essential to that, and the sweet spot for First Five has to be things essential to that. So that it's not a bad thing to do. It's a good thing to do, but it should not be the new definition of First Five is diapers.
Right.
I'm
Uh,
sure no one disagrees with that.
So just a couple other items. You know, we've been, the commission and we have been talking a lot about how to ensure that equity is not layered on top, but is interwoven in all of the work we do. And we're working on that, not only in the programs that we work on, but how do we as a staff also increase our learning and do that good work. So at the last meeting, if you'll recall, Francine Rod, who's the executive director of Monterey County, reported to the commission on the First Five Association's READY initiative to provide opportunities to work on equity on both an individual and organization level. So they, through the association, invited First Five California staff to participate in the United Way's 21-day equity challenge, which started on October 5th. I'm happy to say most of the staff has signed up. So each day staff receives an email with links to reading materials and podcasts and videos about different levels of racism in society today, with Society Today. And on a regular basis, the staff gets together over Zoom to meet and to discuss these resources, the challenges, our assumptions. And so in order to strengthen our own personal and institutional sensitivity and responsiveness. So that is some of the ongoing work that we are doing. We're happy about that. First Five Impact is, it is also, fall is the time of year that's called reporting time. So right now we are collecting information on the annual data that they're required to send in, and also the annual performance reports. So now's the time counties are giving that to us, and we will be coming back to all of you with those reports after the first part of the new year about how we're doing. The other thing I wanted to say is that we had a very exciting, last week we opened, Paul? 2 weeks ago, had a really exciting thing in that we announced the launch of the Quality Counts California reporting portal. Who would have thought that would have been so exciting, but truthfully, it really is. So with the input from our staff, not our staff, but our partners at CDE, we've completed the first phase of the QCC reporting portal, and counties are now able to submit invoices, revise budgets, view and upload important documents related to their grant or grants, and update local contacts. That is an amazing thing to do. And counties are very excited that they're streamlined and there's one place they can go in. Just a shout out to the First Five California IT staff who really built this system for us and for CDE to use as well. It's amazing. So while it's probably not going to be on the front page of the LA Times, right around here it is. So shout out to Paul and to Richard, who have spent countless hours putting this together. So really good. The rest of it is that I was going to talk to you about just for a moment, is all in items you're going to see today. So I'm going to skip that. And the only other one is to say that we are continuing with our through the Child Care Resource Center, who we're contracting with. We are doing the Foster Bridge study. So a while ago, a program legislation was passed and funded for Foster Bridge for parents or for foster or resource families to be able to access childcare in emergencies. Like if someone calls and says, you're getting a child tomorrow, and it's a relative of the child, and they say, but I don't have any childcare, this helps them access childcare very quickly so those children can be placed with families. So really what the study does is say, okay, we've done this for a while, how's it working? And so the study is through surveys and personal interviews with resource families, with childcare providers, and others. So we're excited to see how that goes. Getting emergency childcare, if you're a resource parent, can sometimes be very difficult. So this program, I think, is one that can really help support those families as they do that. So with that, I'm going to close unless you have any other questions.
Comments, questions, feedback?
Feel free not to have any. No, just kidding. Okay, I think we're good, George. Melissa, we're gonna bring, yeah.
Doing a lot of good things and doing a lot of good things well. So keep doing it. Next item on the agenda, we have our First Five Association Executive Director presenting and joining us. We have a new Executive Director, Melissa Stafford Jones is in that role now. I had a chance to chat with her a little bit, talk. It turns out we actually overlapped in the past when we were both trying to get California to have universal coverage before the rest of the world. She's done some really important and relevant things on her way to this job. And my sense is that she's going to provide the kind of support and direction and collaboration that we need going forward. So with that, I'll turn it over to you. Take it away.
Thank you, George. Good morning, commissioners and Camille. Thank you for the opportunity to be with you this morning. I really appreciate that one aspect of our work together as the First Five Network is responsively addressing the direct needs of individual children and families, such as the important effort you were discussing just a few minutes ago, funded by First Five California to provide emergency supplies in response to COVID-19. Today, I'd like to focus on another aspect of our work together, and that is addressing the conditions and context that surround young children and their families, and how by focusing on systems change and systems building, that is really thinking about how can we shift the conditions that hold barriers, problems, or inequities in place, or that don't fully center the strengths and needs of children and families. We can make progress toward our shared goal that all children are safe, healthy, and ready to learn so that they can thrive in school and life. Systems change and systems building work is particularly important for us to do in partnership because of the connectedness of local and state systems and policies. First Five's work at the local level and at the association is guided by 4 principles: whole child, whole family approach, equity, systems coordination, and prevention. And these principles can only be fully realized with state, local, bi-directional engagement and partnership, in which the experience at the local level informs state decision-making policies and systems, and state-level constructs provide the framework and support for local systems to most impactfully serve children and families. And as we know, when we talk about a system, we're really talking about all the moving parts that act together to make something work. And that by focusing on systems change and systems building, we can advance toward our goals, our North Stars, since we know that the conditions and context in which children and families live can be altered by improving the systems surrounding and supporting them. This includes improving access to resources and making sure that our systems deliver those resources are responsive to the needs of children and families, build supports for families, are aligned and coordinated, seek to provide support early, and are sustainable. It's also key to recognize that as part of our systems building work, we may need to address the forces and levers that are holding the system in its broken state at times. System change involves identifying where the break is and examining all the various factors that can be addressed in order to make the system function better. Often this involves calling out deeply connected forces such as racism, poverty, and lack of economic opportunity, and the levers by which they operate in order to make meaningful change. As core backbone agencies in their communities, local First Fives are engaged and leading systems change efforts across the state, working with many, many partners. It's obviously not work that can be done alone. I'd like to share today a few examples of local systems change work and connect those efforts to some of the work First Five California and local First Fives are engaging in together, and I think really supporting a deepening of our partnership. So one example of enacting system change at the county level can be seen in First Five Sacramento. First Five Sacramento is taking a systems approach to the problem of Black child deaths through its role as a central leader and partner in that county's coalition effort called the Black Child Legacy Campaign. The commission provides funding for a collective impact model, which brings together various sectors of the community under the common goal of reducing Black child deaths by 10 to 20%. First Five Sacramento contracts with organizations that do creative outreach with Black families and are trusted in the community. Contractors meet families where they are and provide culturally responsive services, such as linking to perinatal care. The program also works with systems such as hospitals to shift policies and practices to promote safe sleep. All 8 county birthing hospitals now provide safe sleep information. The commission partnered with Sacramento County Public Health to create a campaign to increase public awareness about the root causes of the disparities in Black maternal and infant health outcomes. After these efforts on multiple fronts with many partners were implemented, the county saw a 57% reduction in Black infant sleep-related deaths and a 33% reduction in the racial disparity on this metric.
Those are great numbers.
I'm sorry?
Those are great numbers.
Yeah, I really think it shows this collective impact approach. They also saw an 85% reduction in Black child deaths due to child abuse and neglect homicides, and a 98% reduction in racial disparity on that metric. Sometimes a county's systems change approach can serve as a catalyst for other counties, which then builds toward a statewide body of work over time. First Five Orange was the first county to implement a Help Me Grow initiative for the developmental screening and early intervention. Their success led to the next 3 counties following suit, Alameda, Fresno, and Ventura. Others followed, and now we have a statewide body of Help Me Grows and similar type initiatives. Before Help Me Grow and those similar initiatives took off, many First Five commissions funded discrete programs to do developmental screenings in their counties. Today, however, local First Fives fund the infrastructure through which developmental screenings occur, so that parents are educated and providers trained via multiple touch points. That could be through childcare, pediatrics providers, hospitals, clinics, family resource centers. And many of the counties have set up referral systems to connect families to services and to encourage providers who understandably are concerned about screening if they can't do something with the results. And seeing that one barrier to screening was related to the concerns of health providers, it became clear that a state policy solution was needed. So First Five Association and partners co-sponsored AB 1004 in 2019 to codify best practices around developmental screening. The bill was signed into law and later was complemented by incentive payments for Medi-Cal providers to encourage their use of developmental screening. There are also ongoing discussions about how we can further and better connect local developmental screening system infrastructure built by First Fives and our partners to the health and Medi-Cal system, given that care coordination, prevention, and related services to which children are entitled under Medi-Cal. In this way, I think we can really see the power and impact of a bidirectional approach. Local experience informs state policy and programs, and state policy and programs shape the construct for local work to flourish and deepen impact and outcomes.
That's a really, really good model.
Oh, Good. I'm
It's
glad.
self-reinforcing, it's continuously improving. That's a good model.
Yeah. And I want to share one other area where I think we're really seeing this even maybe go to the next level, and that's in home visiting, which provides another example of how county systems level work can spread and lead to state policy and program change, which, to your point, George, then turns and feeds back into counties improving their local work. Yep. California, as you know, has made significant new investments in home visiting over the past several years. Thank you to the leadership of the governor and the administration. And First Five, of course, First Five California is now funding critical work to support local coordination of expanded home visiting programs. And we know with the isolation and stress brought on by COVID-19 and the resulting recession, family resiliency approaches such as home visiting may be more important than ever, given the strong evidence that family strengthening services like home visiting improve outcomes for families facing adversity. The local First Five role in home visiting has evolved over time with the landscape, from being a creator and funder of direct services to growing our capacity as a convener, connector, problem solver, and leader of local systems integration. Local First Fives have built innovative family support systems of care, working with their partners, and tailored home visiting programs to reach an array of vulnerable populations, such as pregnant and parenting teens, immigrant and refugee communities, and military families in San Diego County, for example.
Again, a really good model because it lends itself to continuous improvement and shared learning.
Yeah. Individuals who are incarcerated as they near release and reunification with their families are a focus in Tulare County. Fatherhood programming in Alameda County to support fathers to be meaningfully engaged with their children.
That's a spectacular program.
Yeah,
that Alameda program is really wonderful.
Yeah. Home visiting in Santa Barbara has emphasized maternal mental health, and Sutter County has helped connect families to basic needs through its home visiting. First Five LA offers a program called Welcome Baby, a universal voluntary intervention for all families in 14 priority communities in LA County. It is a successful model of providing multiple cross-sector services to families based on their specific needs, including a well-coordinated health home with connections to community-based services. Pilots have been launched in Los Angeles County for direct referral from primary care providers to home visiting prenatally. I think that connection between home visiting and the health system is incredibly important, just like we heard with Help Me Grow, and to create data sharing between home visiting and health systems. First Five San Joaquin has been innovative in understanding how funding streams were historically siloed that in reality all aim toward the same goal of supporting early childhood. In the past, in San Joaquin County, CalWORK's family stabilization funding was not all being utilized, so additional families were not able to benefit from it. This led First Five San Joaquin to create the first home visiting program within CalWORKs, which eventually became a statewide program. And within its pilot, San Joaquin added to the curriculum a component for families to learn job skills and financial literacy, thus addressing the important work performance rate that was needed and reporting to the Department of Social Services and the local community. It also demonstrated an understanding that systems work together to achieve family stabilization and thus affect child development. First Five California's new home visiting coordinating grants and the accompanying technical assistance provide critical leadership and are an important contribution to creating a more highly functioning system of home visiting. This will help ensure that the system has the deepest impact for the greatest number of families within the current home visiting resources across programs, and strengthens the foundation to build on. So hopefully over time, we could reach more children and families. So I know the association and local First Fives are very grateful for First Five California's leadership in this work. Existing home visiting programs have varying and overlapping eligibility criteria and other coordination challenge. So to ensure families are best served and resources best used, a coordinating body at the county level is increasingly critical. Here again, we see how the state can support and bolster work that has bubbled up from the counties and help to solve common problems that have emerged. These coordinating grants from First Five California will help address some of the broken parts of the home visiting system. What's more, the promise and potential of greater coordination and systems work within home visiting illustrates why it's a key strategy for First Five to realize its vision that one day California's successes will be measured by the well-being of all our young children. Home visiting touches on so many systems, other systems that contribute to well-being. The healthcare system, including Medi-Cal, the early intervention system, child welfare, mental health, behavioral health, housing, employment. This has been especially true in the time of COVID. In this way, the home visiting work truly embodies the whole child, whole family prevention frame that is core to our collective work as First Five, and gives us a window into the type of work we can achieve together when we connect the dots to center families and see how all relevant systems affect early childhood. So I really want to just express our appreciation and gratitude for the leadership of First Five California on the home visiting coordination grants and technical assistance. So thank you. And then lastly today, before I close, I'm honored to say a few words on behalf of the First Five Association in celebration and recognition of Muntu Davis and George Halverson. Muntu has been an important voice and reality check, as one colleague said to me, to bring focus to the children and families that have been placed in the most vulnerable positions in our state. Not one to hear his own voice, I'm told. We know that when Dr. Davis spoke, he had something very important to say, and we all listened. The First Five Association is grateful for his leadership and his voice to ensure that together we focus on the most underserved children and families in our communities and our state. Thank you, Dr. Davis, for your work and service on the First Five State Commission. And George, when we think of George and his chairmanship of the First Five State Commission and his overall leadership in the field of early childhood, words that come to mind are commitment, passion, and relentless pursuit. One might think that with his background, George would have been driven to focus on only standard health outcomes for children, but as a longtime national leading voice in healthcare, George deeply understood the connections between early childhood, the social determinants of health, and health outcomes. He championed early literacy and its powerful effects on child development and has been a relentless early childhood advocate. He was passionate about getting books in the hands of parents who otherwise might not have access to them. He's been laser focused with policymakers, parents, and providers about early brain development and the power each has to influence a child's life trajectory. Because of him, parents throughout the state have come to know the importance of talking, reading, and singing to children, and they have received books through First Five to put it into practice. The First Five Association deeply appreciates the spirit of positivity, problem solving, and hope for improved child and family outcomes that George has always exuded and led with. We are grateful, George, for your leadership and look forward to working with First Five California in this next chapter to build on your legacy and to advance broad, sustainable, and scalable systems change and policy change, like some of the examples I shared today, that will allow us together to move toward the North Star that all children are safe, healthy, ready to learn, to thrive in school and life. So thank you to both George and Muntu and for the chance to be with you today.
Thank you. Thank you very much.
Thank you.
I think the association is more likely to succeed in all of those areas because you are in the job and you have both the values and skill set that you have. So it's very, very good for me to see you moving into that position. Thank you.
Okay, I think we can move on to the next part of the agenda, which is if commissioners have anything, George, about advisory committee.
Yes, now the agenda now is advice. Oh, wait, are there any public comments?
Oh,
By the way, we have not been
any?
public comments and everything.
No.
Nope, good. Let us talk about the advisory committees. The advisory committees have met and have done some good work. And would anyone from any of the committees care to speak to that work? in the agenda we have in front of us now, some of the materials are the result of some of the enhancements from that committee process. So thank you for doing that. So committees, any reports?
Okay.
Wow.
Oh, Jackie has her hand up, George.
Yeah, I
Yes.
just wanted to say that almost everything we talked about in program is going to be reviewed with all of you today. But we had some good conversations around the family book distribution, small population, county funding, and the smokers helpline. So that is just to say we were very engaged, Molly and I, with their report. But as to not take their thunder, those things are all on our agenda today.
Excellent.
And I would just add that also the Legislative Advisory Committee also met, and I believe you will hear more later. And then also just wanted to note that Molly and I have been meeting with Camille and others. I don't know the name of this working group, but to help sort of refine the way financial information is presented. So hopefully you'll see some of those differences today as well.
And that work is already reflected in today's report. So thank you for doing that. Other committee comments? All right, I'll go to the full public comment. On the entire meeting, members of the public may speak up to 3 minutes on any non-agenda item or items not related to pending judicial, administrative, litigation, or personnel matters. No action by the commission may be taken on the public comment. If you wish to comment, use the raise hand function. For the chat function, if that's not available, Jamie will call on the public in the order in which they appear. So are there any members of the public who would like to comment?
No one has raised their hand, George.
Excellent. All right, well, that moves us on to the consent calendar. We have a number of items on the consent calendar. Items on the consent calendar are to be considered routine and will be enacted by one motion followed by a vote. There will be no separate discussion of those items unless the commission, audience, or staff request specific items be removed from the consent calendar for separate discussion and action. Any agenda item removed will be voted upon following the motion to approve the overall consent calendar. And with that, Camille, do you have any further comments? And if there are no further comments, would someone make a motion to approve the consent calendar?
I think, Molly, you're muted. I think Molly moved, George, but she's muted.
Molly leaned forward, but I couldn't hear her. Did you move?
Yeah,
I'll
still
second.
muted. There.
Okay. Molly has moved approval of the consent calendar. Is there a second?
Second.
Jackie seconded.
Moved and seconded. Any further conversation, any debate? Hearing none, all in favor say, oh, wait, my agenda says Jamie will do a roll call vote. Jamie.
Do we want to take public comment? George, do you want to ask for public
Yeah,
comment?
is there any public comment?
No.
No, all right. Jamie, I guess we needed to do a roll call vote.
Myra Alvarez.
Approve.
Did you say oppose, Myra?
I said approve.
Approve, sorry.
Ooh,
Aye.
that's a harder word than yes. Yeah,
Thank you.
approve.
Montu Davis,
I think he stepped off. He had a meeting at 11.
Monica Fitzgerald,
Yes.
George Halverson,
Approve.
Shana Hazen,
Approve.
Jackie Majors,
Yes.
Molly Munger.
Molly,
Molly?
are you
Yes.
frozen?
Yes.
Yes.
All right.
Oh, dear.
The vote is.
Am I?
In favor?
No, you're good. You're good.
Vote is unanimous in favor. We will now go to the regular agenda, and we are going to hear the financial update. So Marcia Thomas, Director of Fiscal Services, is going to give us a discussion on our financials.
Before Marcia gets started, Commissioners, just want you to know, just want to say thank you again to Molly and Shayna. They rolled up their sleeves and went over all the everything, commas, colors, dashes, dots, everything with us. And so we're excited to present this information to you today. So Marcia, go ahead.
Okay. Good morning, Commissioners. It's a pleasure to be with you today. I have a few updates to share with you all, and then we'll be happy to answer questions at the end of my update. Before I get started, I just want to say thank you to both Commissioner Munger and Commissioner Hazen for working with us on the financial display. We appreciate the guidance you have provided our team, and we continue to incorporate your suggestions into our presentation. The materials in your package should include the financial plan, which is attachment A, the fund condition summary, which is attachment B, and then this PowerPoint presentation, which is attachment C. It also has our financial update included. The PowerPoint is meant to provide additional information that ties back to table 1 of our financial update, as well as our financial plan, which is the attachment A. So with that, I will start with slide number 2. So slide number 2 is our PowerPoint graph depicting Prop 10 and Prop 56 revenues, which is transferred from the California Department of Tax and Fee Administration, which is known as CDTFA, into the California Children and Families Trust Fund. It also includes our surplus money investment earning, which is known as SMIF, which is interest earned on our account. The data for this graph is taken directly from table 1 of our financial update, which is attachment, the financial update, sorry. The graph represents the total revenue amount. It includes both the state commission and the county commission revenue. The solid line is our actuals, and the orange line is our projected. It's important to note for fiscal year 2019-20, we're still reflecting projected, as we have not officially closed out our fiscal year. We continue to work closely with the Department of Finance, Department of General Services, and the Financial Information System in California, known as FISCAL, to close out 2019-20. We are in the final stages, and our hope is to have this completed in the next few weeks, and in January, present actuals to the State Commission. So now slide number 3. This one shows our projected revenues for fiscal year 2021 of $373 million, which is based off the revised revenue amounts received from the Department of Finance back in May. It shows the considerations that go into our revenue projections. CDTFA does adjustments to the Prop 10 revenue prior to transfer, which takes out the state assessments, which is pro rata, which is general administrative costs incurred by CDTFA, as well as Prop 99 backfill prior to transferring the revenue. These are captured in our projections. The chart further illustrates the statutory distribution of 80% to the county commissions and 20% to our state commissions, as well as the statutory distribution among the state commission's 6 accounts, which are listed below: the mass media, education, childcare, research, unallocated, and administration. In the past year, the adjustments CDTFA made prior to transfer to the Prop 10 revenue fluctuated monthly, which made it difficult for First 5 California, and especially our counties, to budget and plan ahead. Together with First 5 Association and the county commissions, we engage in monthly calls with CDTFA. The collaboration has led to monthly revenue discussions, which has offered more consistency, transparency, and understanding of the Prop 10 revenues. It has also led to solutions. For example, together we have worked with CDTFA to spread out the administration fees over a 12-month period to help counties and First Five California with our fiscal planning. Slide number 4.
Oh, the connection, we're having connection troubles. There you
There we
go.
go. So slide number 4 is just showing the percentage breakdown of our 6 accounts: media, education, childcare, research and development, unallocated, and administration. It's just showing the 30%, 25%, 15%, so the 100% breakdown pretty much. So 2021, oh, sorry, I'm jumping a little bit ahead. So slide number 5, please. There we go. So this was displaying our statutory distribution or allocation to the state commission. 2021 is showing projected revenue of 75 million. Each color on the stacked bar represents our 6 accounts. The revenues are actuals from fiscal year 11-12 moving to 18-19. And again, projected revenues are 19-20 to 23-24. So slide number 6. So the next few slides from slide 6 through 11 are graphs of each of our 6 accounts. They give a clear picture of each individual account. We believe that this display will be helpful to the commissioners when they are asked to make funding decisions. These graphs are based off the data from our financial plan, which is attachment A. For mass media, looking at fiscal year 2019-20, the bar is showing that our prior fiscal year carryover is 18 million at the top. That's the beginning balance of, on our financial plan. Our projected revenue is 23 million, and our spending for the year is 23 million. When you look ahead to 22-23, it shows our prior year fiscal year carryover is 20 million at the top. Our projected revenue is 21 million, and our expenditures for the year are projected to be 24 million. This is showing we are spending more than our projected revenues for the year and starting to tap into our carryover balance. The ending balance for fiscal year 22-23 is approximately 17 million, which is carried forward to 23-24. So the next slide, slide 7, moving on to our education account. This one is slightly different than the previous one because it's showing a current commission request in the top right corner. This is displayed in green on our fund condition summary, which is attachment B. The current request is for the kit for new parents. It shows a total dollar amount in the fiscal years it covers. This amount is broken out by fiscal year in green on the fund condition summary, the attachment B. As you can see, the first year is startup and it's a partial funding of 1.5 million for 2021. The second and third year are full production of 6 million for 22-23, and the last year covers a partial year of 4.5 million for fiscal year 23-24. These amounts are already incorporated into our bar graph and reflects the impact to the account overall.
Marcia, I'm
Yes.
so sorry.
No.
I didn't understand that. The kit for new parents request.
So that,
Is-
yeah, it's shown on the fund condition summary, which is attachment B. So if you look at the education account, you'll see it in green and how we broke it out for the 4 fiscal years.
Wait, the slide I'm looking at doesn't have anything in green except current commission request.
Right. So I basically took it off of the fund condition summary and put it to kind of let you know that there would be a commission request of 18 million covering this span, and just to kind of let you see the picture of how it impacted the account. So I was just, it was my way to bring attention.
Wait,
Yeah.
no, I'm so sorry to be slow here, but
No, you're fine.
of course, the first question that you have, the first question that the person, or at least I would have when I see that there's a request here in the kit for new parents and it's expected or requested that a certain amount of money be spent in some upcoming fiscal years, is whether this chart that you've given us
Yes.
includes that money or not.
Yes. It does include the
does.
money. It does include the money, yeah, so go ahead, sorry.
It assumes that the commission grants the request
It does.
and shows what will happen if we grant the request.
Correct.
Okay,
Yes.
and something is shown in green. What's shown in green?
So the commission request, when we are bringing it to the commission, is green on the fund condition summary. So when you look at,
On the table, it's in green ink.
so on
No,
attachment
Molly,
B, so it's
it's
the
attached-
attachment that comes with our financial update. So attachment B actually has the breakdown in green by fiscal year.
Okay, well,
This
anyway,
one is
I'm just
showing-
trying to follow. I'm handicapped by
No, you're
some
fine.
technological problems, but let me just be understanding.
Yep.
That was the thing that I mostly didn't understand, is whether this is showing what will happen if a request is granted. And I just want to make a comment
Yep.
that is confusing. When you have it, in general, the black line shows what is committed. That's what we agreed in our meetings. The black line would represent funds that are encumbered, they're committed, the board has approved them. So if in this slide, you have done something that you've included an expenditure that hasn't yet been approved, then that is a little confusing and we shouldn't do that. That's what I'm saying.
Yeah, I would agree. It's confusing because we really don't know then what that line means.
Yeah, we don't know what, and it's not apples to apples with the lines in the other charts. The other charts always, when it's black, we've discussed this in our meeting, it means that money is gone, really. It's pledged, it's agreed to. Here we have something where the committee hasn't, the commission hasn't approved it, but it's shown as if it has approved it. And that we should not do. That's a pretty big thing not to do. And it doesn't mean that we're not going to approve it. It just means that we want to be very careful with financial reporting, that we're strictly accurate in what these lines mean.
Yes.
So George, Shayna has her hand up.
Yeah,
Shayna has
Shayna, please.
So I think just for clarity, so I appreciate all of Molly's questions and agree with everything you've said, Molly. And I think for everybody else, I think it's really helpful when looking at these slides to also, maybe this is clear to everyone, to look at item 4, attachment B, and to look at them together, right? So when you look at them next to each other on this, like you see the education, and then you can see on attachment B that the green, the request that is referenced at the top of the slide is in bright green on that table. And then you can see exactly the detail of what's being requested, where that 18 million will hit and in which fiscal years. But I think you need to look at both together.
Yes, but Shayna, I know that you're not saying that we shouldn't fix this slide. You're just
No,
saying,
I agree. We should fix the slide.
Yeah, we need to
and
fix the
just as we-
slide. Yeah.
Yep.
Yes, 100% fix the slide. And just in terms of understanding the information on the slide and specifically the requested information, it's very helpful to look at the slide with the table next to it.
Yeah.
Yes, I agree with you, Molly, 100%.
But future versions of the slide will be different.
Yeah, we will definitely make
the
adjustments.
staff has done a great job with this. I mean, Shane and I really, it was a lot of requests of clarification. And so Marcia, thank you for just bearing with this process. How could we think we could get it all done perfectly, in 1 month? I mean, we can't. So it's it's getting there. It's great. So thanks.
No, I appreciate your feedback. We're just trying to make sure that we, present it the way that gives you a better idea and can make better decisions. So it's great. So we'll make the adjustments. We grabbed this information from the financial plan. So the financial plan actually has that commission request built into it. And so it says projected expenditures and obligations. That's why it was kind of incorporated in, but we will take note to break it out in the future. So that way it's a little more clear. So thank you.
But Marcia, you do remember our discussion about the
Yep.
difference between things that have been voted on and approved and are therefore pledged and those that are not. We have to keep that in mind.
Yep. Yeah, we'll definitely make amendments to it, make it a little bit better, touch base with you, and then have a better presentation in January for you all. So I appreciate it.
Yeah,
Thank you.
yeah.
Excellent.
Okay,
Other
so,
comments or questions on the financial report?
I think we're not quite done yet. Keep going,
Okay.
Marcia.
Keep going.
okay,
Yes.
so to be quite honest, I'm not sure where I left off. So let's see, I'll start with 2021. Okay, let's see. So in 2021, it's showing the education account, we're spending 36 million. There you go. Which is more than the projected revenue of 19 million. And we're going to tap into the carryover balance by approximately 17 million. This is mainly due to Impact 2.0, which started in July of this fiscal year. And it carries through to 22-23. So by the time you get to 23-24, you see the drop in expenditures because we don't have Impact anymore. So that's why it's gone down. So then slide number 8. This is our childcare account. It also shows the increase in 2021, which is largely Impact. And again, by 23-24, the expenditures go down, and it's because Impact is over. You'll notice the carryover in this fund is smaller in the out years, so there's not very much carryover in 22-23 and 23-24. And then slide number 9 is our research and development. Same situation where it's showing a higher expenditure in 2021 due to Impact. It levels out and decreases by 23-24. Slide number 10. That's our unallocated account. There's a little increase in spending for 2021 due to the emergency supply order for COVID. Other than that, it's pretty level in 2021, 22, all the way to 23-24. Then 11 is our administration account. You see that the expenditures are pretty level. Our carryover balance is getting smaller by the time we get to 23-24. And then the last slide. Slide number 12.
I mean, stuck.
Hmm.
It's stuck, Marcia.
It's back. Okay.
Look,
Well, the last slide in the
There you go.
presentation.
There
There
you
we
go.
go. That's the fund condition for all of our funds. So this is all 6 accounts combined, the overall picture. It follows the same concept as the individual slides that we saw for the accounts. In 1920, we're spending an overall of 105 million, which is tapping over into the carryover balance by approximately 27 million. So let's see. So First Five California continues to monitor the accounts to ensure we have adequate cash balances to meet our current and future obligations and commitments from each of our designated accounts. We're constantly having conversations about it. I just want to point out, I know there was discussion in our fiscal advisory meeting about the 15%. So I just want to touch on that a little bit. The 15% on these slides are not, it's not incorporated. So when you're looking at the financial plan, which is attachment A, we're taking those ending balances. But if you look at the fund condition summary, it's a little bit lower because we've taken it out of there. So this graph is not capturing that 15% taken out.
And that's a 15% reserve that we have traditionally include. So when she says 15%, we're talking 15% reserve, just to be clear about that.
Sure. Thank you, Camille.
Not a problem. Shayna,
So
did you
that-
have your hand up?
I'm glad I was gonna ask about that and where that showed up. And I just want to make sure that that is clear. So I know that for Molly and for me, we were really trying to wrap our heads around what this reserve was and how it was treated. So I just want to make sure that that's clear for everyone, because I think the other thing, the other place Molly and I landed is that it may require a future conversation, sort of a higher level philosophical conversation about, is that this 15% it's not mandated anywhere, right? It's just sort of de facto been the way we've operated. And so I just wanted to flag for other commissioners that this is something for us to discuss later.
In effect, other commissioners, what we learned is that the first, probably we think it happened this way, the first person, the first executive director decided that having at least a 15% reserve was good practice, and so kind of booked every year a 15% reserve. But then the 15% reserve was erased at the end of every year, and all of the money that had been reserved was simply put into the carryover, because we never spent the 15%, and we carried over even more than that. So there was this great puddle of money that kept, getting carried over, and the reserve was sort of lost in the larger carryover at the end of every year. And yet our accounting system still says 15% reserve, and it can be very confusing. And so the question is, since we do carry over the money, all the money unspent at the end of each year, the designated 15% and all the rest of it, and it's all there in the green on these charts as the carried over amount, what really is the informational value of the 15% reserve? It just isn't really doing anything, neither communicating anything, nor is it guiding our practice in any way. And so that's what Shane, I think, is alluding to about a philosophical discussion about that. We want the commissioners just to understand that there is a large carryover every year in these accounts, and that it's not limited to 15%. And the reason these charts were put together originally by let's see now. I was about to say Aaron. Anyway, I'm sorry. The name of the organization that Aaron and Glenn.
Is Glenn Price Group, Molly?
Yeah, that's right. Glenn Price Group, his son, Aaron. He was the person who came up with this way of doing this. And the commissioners will probably remember that we were trying to understand in the middle of the pandemic. We said, well, what flexibility do we have? What money do we actually have? And so, Glenn was we had the budget retreat, and it was explained or graphically presented that there really is a lot of carryover funds. And that doesn't mean we rush out and spend it, but it does mean that when we have an emergency, we have some flexibility, and we have had an emergency and we have spent a little. But anyway, and we think it's good for the commissioners always to see where we are in that carryover. For one thing, you get a certain amount of political pushback when you don't spend your money. And you just need to know that if they say, well, you're piling up all these reserves, and why they call them reserves, which makes it confusing. We call them carryover. You're piling up all these carryovers, why are you not spending the money? And, that's, again, a philosophical discussion. So
That was the philosophical part I was getting to.
Yeah, and that is the philosophical part. But anyway, yes.
There's
Yeah,
another. Go ahead.
Go ahead.
I was going to make another point off this chart.
Yes.
No, go ahead. Finish your comment. Then
No, I was done. No, I was done. I went on too long. I'm said enough.
No. Quick comment about this chart. That number gets smaller every year, and total amount of money going to first five. when we think about First Five, one of the things that's really, really important right now is to build a really strong and beloved brand. Because if the brand is strong, then future revenue sources will feel right to other people and will be supported. And if the brand isn't strong, if there's not a sense that value is being added by First Five, then when the time comes to change that trajectory, stabilize it or flip it or add some source of revenue, it's not going to be supported. So the First Five brand is actually extremely valuable at the legislature and with the administration when it is strong and positive and literally beloved by people in California who look at the process. So think of the brand and the approach and the perception and the paradigm as being assets. If a business were looking at this and saw that decline, one of the things that the business would look at right now would be, how can we invest that 15% in making the brand stronger? What could we do? Business with this trajectory would look at it and say, we've got to invest in something to change that, put it in a different direction, create a different momentum. And we've got money. The good news is we've got money. We have investable money. How do we take the investable money and apply it to something that will actually increase the likelihood over time of First Five surviving and thriving? And so think of this as part of the brand issue. And that's another reason why it would make a lot of sense for First Five to get a lot more publicity when we get to the learning gap issue, because people really, really care about the learning gaps and are going to want to do something positive. So think of it as a brand thing. And Camille, think of it as, if you're going to invest that money in something and the investment was going to cause this trajectory to go in a different direction, what would that be? You thought?
This is Myra. Can I ask a more basic question, not philosophical?
Yeah, please.
Because I appreciate the distinction between the carryover and the reserve. Actually, that's really, really important. So thank you for that. And then if you look at the fund condition summary for, let's just use next year, 21, 22, the 15% reserve is 2.7 million. But then here we have 101 in carryover. So if I'm understanding, there's about $99 million that is a broader conversation about how we may want to spend it. Wow. Thank you. That's super helpful.
Yeah, and I just want to, again, Myra, just to just build on what George said. George alluded to the fact, and it's our first slide, it's the trend line, you know, how the thing is going down. When the money started shrinking, and it started shrinking a long time ago, people became very worried about that. And they thought that the way to keep the organization alive was to underspend a lot every year so that you could stretch the money. It's like, don't eat your candy bar, just
right.
That way, you know, it'll last longer. That's the kind of thing. And so you can't, it's not a criticism that people have done this, because they had a reason why they were doing
Totally.
it. It's very interesting what George is saying. I found George's remark very interesting, because that's a less defensive crouch. It's, you know what? If we invest in our brand, then the chance that we're able to, say, pass another initiative or persuade the legislature to redeploy a stream of income into First Five as ours dwindles, or some such solution, becomes more likely. And I think that's very, very interesting, because that hasn't really been the thinking. The thinking has been, we've only got this money and we have to stretch it out. So good talk, and even a little bit philosophical.
Any business looking at that chart right there would say, how do we invest that asset and that resource into something that's going to change that revenue line? And when First Five, the brand, and the fact how good people feel about the value of First Five is really an important part of that. So doing high value, high visibility things, and the Talk, Read, Sing campaign has done that really well. I mean, people at the legislature really like the getting a talk or getting a First Five recommendation right now, and the ad campaign took that a long way down the road because the ad campaign is so visible and so popular that it makes First Five feel like a good thing. That's just basic brand management and manipulation and optimization, and we need to continue to do that, but need to do it very intentionally at this point. It was part of the goal was to do that, but now part of the goal maybe is to do it even more and then utilize the value for that purpose. That makes sense?
Mhm.
Huh, okay.
I think, Marcia, is that your last slide?
That is my last slide. Yes.
Okay. Any public comment? Any other board comment?
No, I have my hand up. This is Chris.
Hi, Chris.
Oh,
Hi,
Chris,
everybody.
please.
Hey, one more beat on the history of the reserve. When we were running First Five around 2005, 2006, 2007 during the Great Recession, there were a number of transfers between First Five California and Mr. Mib, which has been dissolved since that time to protect children's health insurance programs.
Yeah.
It was actually during that period of the commission's history that there was considerable concern that if there were no reserve in addition to the 6 mandatory accounts, that if those transfers continued, we would find ourselves in a situation where we were operating only on annual revenue, which is possible. People do it in every other department in state government. It's standard. No other state department carries any reserve or carryover. In this case, we were so concerned by our long-term commitments and other obligations that we wouldn't be able to meet them. So there was a reserve created to meet contractual obligations 2 or 3 years into the future as we were watching these transfers or living through these transfers to cope with the Great Recession. So I just thought I would add that beat to this conversation.
Thank you.
It did not
Very
start with
helpful.
the first executive director. It started with actually the third executive director. So, you know, that is just FYI. I mean, we've been through some very difficult economic times in California, and we're in one again. And we're also in a health pandemic, which has presented a second layer of crisis for the state that we've never faced before. At least during the commission's existence, it has not occurred. So that's all. Just a little additional information.
Very, very helpful, Chris. Thanks for that.
Yep, very, very useful.
Can I just ask, now that Marcia is gone through the slides, helpful? The presentation and the slide and display help more, better? You know, thank you, Chris, for nodding. Anybody else, you know, or I guess what I would ask is if upon reflection, you have other suggestions or something, let us know. You know, we're going to continue to work with Molly and Shayna, but we want to get this right. So we're hoping that this way at least gets us started down that road. Jackie?
I just want to thank you guys because it is getting there, you know, and as everybody gives feedback about what doesn't make sense and what would help us get better towards a document and a process that informs us to make good decisions. I think you guys have come even a long way since I've been here. So I appreciate the fine tuning that you all will still do with the commissioners, but I just want to thank the staff because this is, I love charts and I love that this is just getting us closer to really understanding not only the history, but the investment opportunities that we have to make going forward. So thank you.
Thank you, Jackie.
Okay, I don't know, George, do you want us to see if there's public comment?
Yes, I do. Is there any public comment?
Nope, no.
None. One quick comment on COVID.
Hold on,
Yep.
hold on, we were wrong. Somebody's got their hand up.
Good. Public comment, please.
Daniel Berman.
Daniel Berman,
Daniel, welcome.
there, we're getting him up on the screen somewhere. There he is. Daniel, there you go.
Oh, here, I'll turn on my video so I'm not an invisible voice. Thank you for the opportunity to make public comment. I'm Dan Berman. I'm an administrative analyst with First 5 Humboldt, following along with you guys. I'm looking at the very final slide here of all funds, and I realize maybe this is too long a question to answer, but it really, I wasn't sure why, when you go out farthest to the future here to 23, 24, why you guys are proposing shifting from spending some of the significant carryover to actually what I see on this graph is your proposed expenditures at that last year out are actually less than your projected revenue. And I don't know, is that an attempt to rebuild the sort of reserves, or is that just because you haven't programmed everything, which makes sense that far out?
Yes, that's what that is. So
okay.
What you see in that slide is impact has come to an end. So we have more, the commission has not yet determined what the next investment will be. So that's why you see that.
The plan is to invest in something.
Yes, we just
excellent.
haven't.
That makes sense. Thank you very much. And I guess I just say I think it is a good idea to spend down such a enormous reserve relative to the annual revenues. I think this is a great time to be making those investments. So I appreciate that you had that reserve, and I think Commissioner Perry, was right on that. This is an emergency. It's a time to spend reserves to help people, help kids around the state. So I appreciate that you guys are perceiving it that way. Thank you.
Thank you for the comment. Anybody else? No. Nobody else. George, that's the end of public comment.
All right, that's the end of that. We're going to move on the regular agenda to staff presentations and kit for new parents. A quick comment on COVID, by the way. I'm spending a lot of time working on the COVID situation with both the COVID Coalition and a couple of care sites and some people from CMS, and the likelihood of us just having a magical turnaround moment is extremely low. And there are half a dozen vaccines. Dr. Davis can tell you what's going on in great detail in this space, but there's several vaccines. They're probably going to be there. They're going to have a relatively low effectiveness rate. They're not going to be vaccines that stop every case. It's not going to be like polio. It's going to be more like the flu, where you get 60 to 80% stoppage. And then we're still going to have all kinds of cases. And so the long-term strategy is probably going to have to be best care. It's going to have to be magnificent, detect every patient immediately, and then immediately provide the first level of treatment, and then provide the second level of treatment, and do things like apply the steroids quickly. And what we need, what we will have, there are a number of the big care sites are using artificial intelligence algorithms to figure out exactly for each patient what are the specific types of interactions that can be done to optimize the result for that patient based on their characteristics, their comorbidities, or whatever. And so we're likely to have computer supported care in that space in a better way, but not this month. That's the first versions of that are being done and will happen. But we're going to be stuck. I guess what I'm saying from the financial report is we're going to be stuck in this path for a very long time. And it's not going to be likely that we're going to get any kind of a break on all of these odd expenses we have from isolation and from the challenges that exist in the community. And a lot of the families are going to be in much worse shape because everybody's going through their reserves and the pass-through reserves. A lot of people are in tough shape, and that's not going to get better. That's going to get worse. And so we've got bad times ahead, and need to be planning for that as part of the agenda. And there could be some good times ahead, and some, if we really do get best treatment, optimal treatment, figure out how to synthesize some of the things, do the right approaches. If we get the death rate down to 2% or lower, then it's going to be possible to reopen things and reopen the economy and go forward with this being just something that people get periodically, and then create herd immunity by having all the kids get it and go through that kind of a process. So there are some strategies down the road. They're now trying to do data supported care models into the future to figure out optimal results. And right after the election, they're going to be offered to both parties from a number of people. But we have to get through the election first. But even with the best approach, it's going to take a while. I mean, we're not going to get out of this in a hurry. Sorry about the bad news.
Okay.
I'm going to jump in here real quick.
Yeah, please.
Just on that, I think you don't want to get herd immunity by infection. It's going to take too long.
Right.
It's going to take too much in terms of what may happen with people in terms of illness as well as death.
Right.
So herd immunity is going to come from vaccines. And there will be two doses that people will have to get. So what we're going to be in store for is really the preventative measures that everybody needs to take, in terms of coverings, et cetera. That's going to be where we're stuck. And that may increase some costs just based on administrative costs related to that. But I just wanted to sort of clarify that just as we move forward. Treatment will get better, definitely will help in terms of the death rates, but we still need to make sure that we're preventing it in the first place, whether by vaccine or by our practices.
And we need better masks. I mean, when you look at the prevention, having the masks now are marginally much better than not having masks, but it's entirely possible that we can come up with better masks and produce them in volume that will change that trajectory as well. So there's a whole series of things that need to happen going forward. And I think there's some really smart people working really hard in that space to do that. And, but to your point, there's no immediate answer. It's not going to happen right now. It's going to happen over time. And First Five is going to have to make good decisions to survive that process in good ways. So with that, I will move on to the next item on our agenda. And
George, before you go forward, Jackie had her hand up.
Yes.
Jackie had her hand up.
Thank you. It feels a little delayed because it seems like we've moved on to something, but I feel I feel like it's important to just say what's on my mind around our expenditures. And I agree with what everybody's saying. We're in a rough time, terrible time, and we have to make those investments. I also just encourage us to be strategic. This thing is not, 2-3 months. And so there are a lot of other entities right now that are coming to the aid of families and communities, and we have to leverage our dollars. And I appreciate the desire to sort of get money out and resolve issues, but this is going to be a long winter. And so I know there's money there, lots of money, and we're not, necessarily saving it, for some glory day. But I do think we have to be really responsible to what resources are already out there, so that in 4 months, when the needs of children change, which they will, we are prepared to respond to that and invest appropriately.
I think that is really, really well said, and I totally agree.
Okay, thank you. Okay, now we should move on. Yay. You want to move on to the parent kit, George?
Let us move on to the parent kit.
Okay. So commissioners, we're pleased today to bring you this item that is actually going to request funding for the continuation of the parent kit. Vernetta Sypax is the queen of the parent kit. Vernetta is been our person for a number of years who has works on everything from the taking of orders to the what's in the kit and beyond. So with that, Vernetta, I'm going to turn it over to you to talk about our request for the parent kit.
Thank you, Camille. Can everyone hear me? You can hear
Yes,
me?
I can hear you.
Okay.
Yes.
Just making sure. Thank you. Good morning or good afternoon, commissioners. I'm happy to join you today to present a request to continue production of one of First Five California's foundational programs. Our agenda item request is to approve funding for up to $18 million over approximately 3 years to implement and refresh the Kit for New Parents program. And I'm looking for some slides.
Simon, they're coming.
Okay. Okay. And this will be slide 2 when it comes up. The funding for the kit, if a funding is approved, this will allow staff to release a request for proposal or RFP for kit fulfillment. The RFP will enable First Five California to carry out all tasks associated with production and distribution of the kit. And it will also allow us to better streamline the kit modification process and help both parents and organizations easily order physical kits and access kit information online. Approval of the funding will also allow staff to procure additional services in support of increasing access to kit information and improve delivery of kit content to California parents and providers. I'm going to bring up my slide here. As part of our plan, First Five California will transition kit production and distribution from the current kit vendor, which is the Office of State Publishing. And this is slide 4.
There you go.
As part of our, to the Office of State, from the Office of State Publishing to a new contractor starting in April 2021. The transition between OSP and the new vendor is scheduled to be complete by June 30th, 2021. Beginning in July 2021, the new contractor will distribute previously built kits transferred from OSP and use the existing inventory to build kits in order to ensure continuity of service until we release the updated kit in late 2021. We will work with the Program Advisory Committee on the development of the kit and report progress to the Commission on a regular basis. And we can go to slide 5.
It's coming, but there you go.
Okay. And now I'd like to share some background on the kit. The kit is considered by many to be the finest publication that First Five California has ever produced. Since 2001, through our partnerships with First Five County Commissions, we have distributed over 5.4 million kits to organizations such as hospitals, WIC offices, family resource centers, and various social services organizations and community agencies. Kits can also be ordered on First Five California's parent website by parents and organizations. I would like to note that in fiscal year 2019-20, there was a decline in distribution from the previous fiscal year. This was due in large part to the impact of COVID-19 on the organizations that distribute the kit to parents. Numbers recently have started to increase again as many of the organizations have reopened. With the planned refresh of the kit design and the upgrades planned to increase access and ways of ordering the kit, our objective is to increase our distribution toward 300,000 kits per year. And we can go to slide 6. We also plan to expand the availability of information in additional languages. Currently, the kit is available in English, Spanish, Chinese, Korean, and Vietnamese. Earlier this year, we held facilitated focus groups with parents and First 5 county commissions. First 5 county commission focus group participants said that the kit serves as a vital tool for family engagement. Parent focus group participants said that they view the kit as a trusted resource that they can rely upon. Both parents and First 5 county commissions emphasized that the physical kit should continue, but also requested to expand the ability to access kit information in a digital format as well. Details of the focus group findings can be found in attachment A, the kit focus group results and redesign PowerPoint presentation that was presented to the PEO advisory committee meeting in August. We can go to slide 7. Based on the focus group results, we plan to add content to the physical kit, refresh the kit design, and add digital access to kit information via development of a mobile app. We also plan to make downloadable resources available on our kit ordering site, our redesigned kit ordering site. The RFP we plan to put out will give First 5 California the flexibility to efficiently update the physical kit and also quickly revise kit content to reflect changing circumstances happening in the world right now. Increasing access to kit information is especially critical during a crisis such as the one we're facing with the global pandemic. First 5 California will continue to conduct focus groups with parents, county partners, and advocacy groups for feedback to ensure that the kit meets the needs of hard to reach and low income parents when they bring home their newborn. And we will also be taking steps to make sure that the kit content is linguistically and culturally appropriate. The feedback that we receive will help strengthen the kit as a trusted resource for parents and providers. First 5 California's goal is to provide parents with comprehensive and updated information and access to important resources via their smartphones and other connected devices. And we can go to slide 9. I think I forgot to go to, yes, let's go to slide 9. Since 2013, the Commission has authorized approximately $5 million annually for kit production and distribution. The request of $18 million from the education account will fund continued production and distribution of the kit for new parents through June 30th, 2024. And we can go to slide 10. First 5 California staff recommends the Commission approve up to $18 million to fund the continued development and fulfillment of the updated kit for new parents from fiscal year 2020-21 through fiscal year 2023-24. And I would be happy to answer any questions that you have. Thank you.
George, do we want to take questions from commissioners? I think you're muted, George.
I was muted. Okay.
Yeah.
Any questions? Any comments?
Yeah, I have a question.
Feedback?
I have a question. Yeah, I have a
Molly,
question.
great.
Sure.
Yes.
So what percentage of babies born in California are are going to be reached by the figure of 300,000 kits a year?
That is an excellent question.
About a
And
third.
It's about,
What? I'm sorry. Yes, what?
we are currently reaching with the
David Dodd.
currently we're reaching 32.9%, and that is with 152,000 kits distributed. So that would be doubling. So that's probably about 60% of parents.
David, actually, Bernetta, David Dodd.
Better
down in the corner.
information.
He's.
Yeah, so that's correct. 300,000 would be just a little over 60%. So kind of as a general rule of thumb, we've historically had about 500,000 births a year. Actually, it's lower now. It's around more like 480,000. So it would be just over 60%.
Well, okay, just to follow up then, the 40% of children that do not, or families that do not receive the kit, how does it happen that they don't get a kit? What happens to that some kids in some hospitals get it and some don't?
Well, 300,000 is the target goal. However, we have the ability to produce kits beyond that point. It is all, in my experience, it is all due to demand. We can increase demand by increasing our promotion of the kit. Back in 2007, 2008.
Demand from whom?
Pardon?
Demand from whom?
Demand from counties who provide the kit. Counties are the chief distributors of
So
the
the
kit.
customer for the kit is the county, and the counties distribute.
Well,
So
the
to
customer for
Molly's
the
point,
end,
why?
the end,
Let me ask you a
pardon?
different way. Why aren't we at 100%?
Why aren't we at
Why don't we
100%
get this to 100%
distribution?
of the children in California?
Maybe Shana knows. Shana seems to know. She's
No,
signaling.
I'm just struggling, right? When we talk about equity, like, I don't think we need to necessarily get kits to 100% of the kids. I think for me, the question is, are the kits going to the kids that we want to reach, right? So that the whole is not every single child born in California, I don't think, but it is a certain segment of that population. And so I think I want to know I think it's important to ask who they're going to, and is it the right who, not is it 100%? I don't know that that's the right goal.
Well, one of the struggles that we've had with the KIT program, to be frank, is tracking where the kits go. One of the, we will be increasing our tracking of where they go with this increase in funding, because we will be refining the way that kits are ordered, refining the way that we can track where the kits are going.
I'm wondering, because I think that's important, the tracking, but rather than waiting for the tracking, sort of for that data to tell us where, can we dictate or make some recommendations to the counties about where they go?
We can absolutely provide guidelines to the counties as to where the kits go. That is absolutely, we can do that. And that will be part of our plan to distribute the kit. In the past, we have not had guidelines as to where kits go. However, based on the organizations, most of the organizations that receive the kit, they are mostly going to Medi-Cal recipients and to WIC offices. We can tell that just from our shipping records of the organizations.
Great.
Yeah, right. I think we can give you like what types of organizations currently get the kit. We couldn't tell you exactly families. Do you know what I mean? How families range.
But we know the demographics of the families served by those organizations. We do know. Yeah.
Yes, we do. Yes, we do.
And so So George, while the counties are the bulk of who receives the kit, we also, as Bernetta said, do a lot with hospitals. She has a lot of hospitals who order the kit. We have WICs, we have family resource centers.
We have correctional facilities, the military, community colleges, preschools, all types of organizations. We run the full complement of organizations that distribute the kit throughout California.
Right.
And also, I wanted to address the question that Molly had about, and also, about why kits don't get to everyone. We also are limited by budget as well, because the cost of components for the kits, there is a cost for components of the kits. And so we do need to target the kits toward, we're going to have two kit parts with this new refresh. We're going to have the physical kit, which we're really targeting toward the low income and hard to reach community. And we're going to also have a digital complement of the kit, which will provide wider access of the kit to parents throughout California. It's not meant to replace the physical kit, but it is meant to expand access. And that's why we would like to invest in the digital.
We could set the goal of getting that to everyone.
Pardon?
We could set the goal of getting that one to everyone.
Yes, absolutely. And that
back to
is
my goal
the
setting,
goal.
Why not set the goal of getting at least the digital kit to everyone?
Oh, absolutely. Yes.
Yeah,
Yes.
but what I'm suggesting now to the commission is make that a goal. Make that a goal.
Yeah.
I mean, make it a goal and then follow up and see if it's happening. It's very basic. It's very simple. It's elementary. It's functional. It's operational, and it's measurable. And the minute you get something that's measurable, that's really valuable. So 100% saying that at least the digital kit should go to 100% of California parents, and staff should report back to the commission on a regular basis on what that number is and how that goal is going. Does that make sense to the commission?
It makes sense, but I don't know if I agree. For me, that is a nice to have, not a need to have. And so setting that goal, if it means taking away focus on making sure that all of our underserved families and the families that we most want to reach get the physical kit, if that 100% getting the digital kit takes away from that and limits bandwidth, to do that other more important work, I don't know that the 100% goal is something we should be driving towards.
And I would suggest,
nice, but as we look at,
done a lot of I'm sorry.
No, go ahead.
Having done a lot of operational stuff, I would strongly suggest that 100% goal would not take away anything from anyone. And if anything, people doing the other work would be inspired and motivated to be part of an agenda that's aimed at getting it to everyone. And doing internal resource trade-offs based on the distribution of the hard kit and the electronic kit, it's hard to imagine that those pathways intersect. And if they do intersect, back to the point, ask the team to figure out if that is the goal of getting it to every single kid, because all the kids are part of the first 5 commission agenda. If that's a goal, what is the downside of that? What's the risk of that? And what are the costs of that? And then also, what's the agenda in that? I mean, I've done 100%. We did 100% on immunizations. America had the worst immunization rates in the world. And we set a national goal. We took it out to everybody. And we flipped that over, and now we are up at, until the crazy people started kicking in on the anti-vax stuff, we actually were at, but we did it because we said every single kid's going to get this vaccine. And people said, well, there are other priorities. No, for this particular set of energy, the priority is to vaccinate every kid. I would suggest this would be the same. Let's vaccinate every newborn with at least the electronic kit.
I just have one comment, and I know our time is limited, so I encourage us to move on. I think 100% goal is somewhat unrealistic, but I think lofty, and something that's wonderful. I think what we have to remember, though, when we're talking about 100% children, some of these are second and third and fourth children to the family. So these are resources that are for parents. And many of those parents may have those resources. I know there's books and other things that are really important, but I will again sort of encourage us as we have this very shameless goal of trying to reach underrepresented populations. We have to be intentional about that. And I think we can have, honestly, George, I think we can have that goal out there because I think it's a nice one to have, particularly for the digital. But in terms of the staff tracking that and all that, I just think that's not the best use of their time. And I will say in that, I would love, and I'm just going to throw it out there, I would really love some sort of a dashboard so that we can see the parent kit success and impact to our target. So we can see the some of the other work. I don't want to list it because I don't want to take too much time. And I hate to put more work on you guys, but I also think if we could just sort of see these dashboards, because I've watched the commissioners and myself ask you guys some of the same types of questions each time, because our heart is in the same, our heart and our mind is in the same place, reaching these families. I appreciate that all of California families are our goal and all California families are our goal, but our families of color are experiencing unprecedented poverty and challenges, and those are where the risks are. So I would say I think I appreciate 100% as a goal. I have 100% weight loss goal. It ain't happening, but I'm looking at the smaller goals. So I just want to be realistic in terms of our tracking and our efforts.
I know you don't really need me to, say more, but I think there's something that can be added here. First of all, the reason I asked about what percentage of the kids were the families were going to end up with this was precisely because I totally agree with Jackie and Shana about this. And if the answer wasn't going to be 100%, then we had to figure out, and then that was kind of where I was going. So it was all fine. I just like to pause on the idea that what we really ought to have is a goal of reaching 100% of the low-income children. Why don't we do that? Why don't, and if we would do that and then work to that and then, motivate the staff for that and do the record keeping for that, and then we could explain to all of our partners, this is what we're doing. This is very, very important. I mean, to Jackie's point about the conditions in which people are experiencing right now, I mean, you really want to get them it's a tangible boost. It's a great thing to land in a poor family's life. So I'd like to suggest that we make that the goal, and not to take anything away from what George is doing. We've got the website team. I know they'll work on it, but I agree. Data collection on how many people get it off the website, it's probably not as important as being sure that the poorest families with the most troubles get the physical kit for the comfort and the security it'll give them, and the fact that they don't have the bandwidth logic often.
I would concur with that. I love the conversation.
David Scott. David has his hand up. David Dodds.
Yes, so briefly, just responding to the discussion about data. So we are going through an internal review of our data, including shipping data that Bernetta has, which includes which kind of organization gets it and which languages. Also, commissioners may want to know that the California Health Interview Survey, which we fund, that includes questions on the child questionnaire about the kit for new parents. And we're in the process of working with UCLA to prepare data that we can share. So it's a little bit tricky because there's time distortions in the data about when the parent got the kit and when they know about it, and versus having a new baby and getting the kit. But we are working on that.
And are we able to then layer the data? So in terms of the demographics of who is getting the kits, are we able to see all of that through that?
So the California Health Interview Survey does have quite a bit of, it has a lot of background details, and the data can be broken out by race, ethnicity, income level, immigrant status, etc. The tricky part is as I said, is defining the time scope of the question. So that's something we're actively working on at UCLA right now, so that it's easy to understand.
So you could take a look at the points that Molly just mentioned relative to access to the kit by those folks. But back to Molly's point.
George, you're frozen. I think George is frozen.
Making it happen in all kinds
There
of
you go.
creative and positive collaborative ways. So there's a lot of value in doing that, setting that up and making that happen. But there's multiple goals. In this particular one, it might make sense to ask Camille to come back to the commission with a recommendation for what are the most reasonable, measurable things in this space, and looking at the idea of getting the kit to all of the most important, the people who will value it most. And you can measure that both on the front end, did you send it in their direction, and on the back end, did they get it? In both of those, it's like the blood sugar measurement. Both of those are good. And if you're sending it in their direction, that's a start. And that start is enough to make a big difference. So I would suggest maybe, Camille, that you go back to the commission with recommended goals and measurements in that space.
You know, I really hate to say this, but I worry that the politics of some, maybe many of the counties may not necessarily favor the priority of 100% for the low, make sure that the most needy children are served first. You just never know what happens at the county level. You can't count on it. And so I'd like to have us have something that we can use so that we can say, you know what, this was only approved by our board on condition that the priority be to the low income kids. That's a condition of the grant. So you really can't do this if you're not willing to accept that and bind yourself to that. I'd like to put some teeth into it rather than just sort of say, well, let's do the best we can, you know.
Perfect. Well, is that an amendment then? Is that
yeah. I'd like to make the motion that we approve it on condition that the kit for new parents will be provided, since it can't be provided to everybody, it will be provided first to the lowest income children in California.
Yeah, that is a motion. Is there a second?
I have a question.
Yes.
So in terms of, so if the goal is 100% of low income children and families, is the 18 million sufficient to do that? And I don't know what that number is in terms of that population, but I just want to make sure that it's enough, because I heard her say that, well, because budget restraints, but then I look at going back to the slide on education, that bar graph, right? There are budget restraints and then there aren't budget restraints. So I just want to make sure, right, that we're not being sort of penny wise and pound foolish.
Well, let me just say, with a 60% or more of the kids served by the kit, we have enough money in the budget for 60%. And I don't think that, 60% of the kids are not in dire poverty in California. A horrendous percentage are in poverty, but probably not 60% in direst poverty, probably not. And so that was my thinking, that we should, if we are serving the bottom 60, we're probably not terrible. But if you'd like to supplement the request for more money, or
I just want to make sure that we all feel good about that amount being able to achieve the goal of 100% of low income children and very low income children, that both of those categories getting the resources.
You could possibly second that motion and then add an amendment to that effect. So are you seconding the motion?
Well,
That-
can
no
I
one can
suggest
be
another, let me
targeted.
suggest another way of doing this.
Yeah,
Why don't we approve the appropriation today with the condition as stated, that the 60% of children served by this money so far will be the 60% of the poorest children. The bottom 60% in income will be served by this money. That will be the commitment and the condition of this grant. And then when Camille and her team do exactly what George is suggesting, go back, think about it, figure out whatever, they may come back, and I wouldn't be surprised them come back to either say, we need more money, to Shayna's point, or they might come back and say, that will require more outreach, more data collection, more sophistication about our records than we have built into this grant, and that's why we need more money. But one way or another, giving the staff a second chance to come for a supplemental appropriation on this makes sense to me.
okay.
Does that make sense to you,
So on
George?
that motion,
Sounds good,
you
yes.
move then the motion that's here.
The motion is that
I
we
second that.
approve we approve the motion in the book with the amendment that the money be targeted at the 60% of the poorest children. So
60%.
that all of our partners know
60%
that
poor
that's the
children.
priority. That's the priority. That's what we're doing. That's the goal. That's what we're doing. And the discussion is that we expect that will be 100% of the poorest kids. I mean, that's what we expect. But to Shayna's point, we'll get more data on that. And we'll also get more data about administrative cost in order to put some, we may need to put some supports under that as well. Does that make sense, Camille?
Camille, does that work for you?
We're gonna have a lot to think. Yes, it does. We can make that work. But I just wanted to say Muntu had his hand raised at one point, so just want to make sure we hear from him as well.
Muntu.
Yeah, I'm just trying to clarify. So the reason for saying low income and very low income families is the idea that they may not have the resources otherwise. I'm just thinking that there probably are kids that are high risk and could use these as well. But I just want to make sure the understanding is saying income related to this is the presumption and the assumption that those families wouldn't have the resources otherwise. Is that correct?
Yes, I think that was what I was thinking. Yes.
Okay, got it. Thank you.
So we will come back to you. We understand the commission's direction. I will say to you, currently, anyone can email in and ask for a kit. I mean, the online ordering doesn't ask for your income level, for your, so we're going to come back to you with a way to really focus the people, everyone we work with, the counties, the hospitals, the other, and we may have questions or conversations about how we go about with maybe that piece of it.
And the motion was to cover all of those kids, but not only those kids.
Right.
So it's all of those kids, but not only, so also other kids can get it, but definitely all of those children get it.
Right.
Does that?
Got it. We're clear. Yes.
Okay.
Camille, I would suggest trying to consider some proxies for how you might be able to identify the kids. It could be geographic area or something of that nature. But I would think about it in that way. What proxies might get you to the group that you're trying to reach?
And I agree with that. I was thinking the same thing. I noticed that in the presentation about LA County, they did the home visiting by zip code. And at Advancement Project, we often found that zip codes were pretty good. And you can even go lower to lower, divisions. But because the address of the parent is something you can grab.
Yes. Okay.
So I think we had a public comment. I think you had at least one public comment.
Good.
On this
Let's
item.
invite the public comment.
Samantha Bond, you're being let in now. Maybe.
Samantha, welcome.
There she is. need to unmute yourself.
Yeah, working on it. Thank you.
There you go.
First, I'd just like to say thank you for giving me the opportunity to speak. I am from First 5 Mendocino, so I can speak on a little bit of the county challenges, as I'm the person who's in charge of some of the Kits for New Parents distributions. We take a 3-prong approach to distributing a Kits for New Parents, which is one, we'd like to get them out prenatally, ideally when they're most receptive to the information. Secondarily, we do it to pediatrics so that they can get them during their first or second visit at pediatrics. And then we do it tertiarily through things like family resource centers, WIC, and stuff like that. And so those are our 3 target areas. And our goal in a very poor county to begin with is to reach all of our children. This is not always possible. This is not always doable for us, simply because of where people are going and the ability to get to where those kids are going to be. So that's a huge challenge for us. So when you're talking about this 100%, I'm going, oh, that's a lot. And additionally, we also are in a county where broadband is extremely challenging. So that 100% goal of getting people onto the app is just unrealistic, especially if we're talking about the lowest income individuals. There's a probability that they don't even have the phones required for, or the broadband necessary for apps and services like that. Now, don't get me wrong, I think all of this is great, and I would love to continue with the Kits. I know that we weren't in the surveys. We had a leadership changeover, so we weren't included there, so I do apologize. And then the other piece of it that I just kind of want to bring to your guys' attention, and I'm sure other counties have said this as well, it's very heavy in reading materials. And reading materials for those who are low income tend to be very difficult, because we're also talking about individuals who are lower education. That doesn't mean that they can't read, but some may not be able to. And so having a lot of physical reading materials is challenging, and most often that's going to get tossed. Whereas we can look at things that are physical necessities. One of the things that our pediatrics team is constantly telling us that they need before COVID is things like thermometers. Parents don't have thermometers, and we think of it as, oh, well, we have them, but if you look at some of the cultural components of it, a lot of people still utilize, the wrist to the head to make sure if a child has a fever or not. And we know that that's not a great indicator. So just to take that into consideration as you go through, and to take into consideration the challenges for a rural, very spread out, very diverse county such as ours. Thank you.
Thank you. Other public comment?
No, that's it. You still need to vote, George.
Yes, we still need a vote. If there is no further comment, I'm going to call for the vote. All in favor of the motion, say aye.
Aye.
Did I see people
All right.
raise their hand?
It looks like
Everybody?
everybody. Any opposed, say no. All right. It is all ayes. There are no no's.
Okay.
Go forward, do good things. And those kids do make a difference. And there are people that benefit a lot. And again, every child who benefits is a child who benefits. And that's a different life trajectory. So well done. And thank you for the report. So that brings us to the point in our process where we have a lunch break scheduled. What do we want to do about lunch?
Before we go to lunch, can I just say one thing?
Yes.
I thought that was a very telling point that the last speaker made about the predominance of all the words on paper. And I want to remind us that one of the things they're going to put in the kit, as I understand it, is a book that doesn't have any words. Not in any language. It's a book that just has pictures. And that's good thinking that somebody did at the First 5. I love that. And more thinking like that might need to be done in the wake of this motion. If we're really trying to reach highly challenged families, we might think differently about the kit a little bit. Just saying.
Right.
another thing to conjure with as you come back to us for refinement in the wake of the approval of the motion.
Yes.
Good thought.
Good point. Well said. Okay, that brings us, what would we like to do about the scheduled lunch break? Should we
George,
have up to half an hour for lunch? Should we take that lunch break and reconvene in half an hour?
Yes, they're saying yes. Just so you know, commissioners, we're running about an hour behind. Not to say, but just letting you know. But this, after there are no more action items, the rest are information, all interesting, good information, but maybe I'll just send a little email to make sure people are jolly on the spot for this afternoon. So half hour sounds good. Everybody okay
All right,
with a
30,
half hour, 30 minutes?
What time do we have? 2:50?
1:30?
What time is it there?
It's almost 1 o'clock. Can we say 1:30?
1:30 is good. Does that work for everyone to reconvene at
Okay.
1:30?
Yeah.
Anyone object to that?
Okay.
All right.
Nope. I think we're good. See you then.
See you then.
Perfect. Thank you.
Uh-oh.
Hi there. We're waiting for a couple more people to jump back on.
These are great thermometers.
Good. Good, good. Hope they,
They're really, did you see the kit?
yeah. Yes.
I mean,
I
that's
have,
an amazing little kit to carry them around in and to be safe.
yep. All good.
And
There
the batteries are charged. How do they charge?
I'm not sure yet. I have no. Shayna says no. She's
No, my kids had a field day with it yesterday. It like came to our door right before bedtime. And so, yes, we know all the ins and outs of the thermometer. And down to the fact that you have to recalibrate it because it was reading too low. I can tell you everything.
there you go.
Wow.
All right. If you're ready, George, we'll go ahead.
That's a really lovely thermometer.
Good. Good. So you ready to get started?
Is David there?
David Dodds.
He's there.
You know what? Interestingly, you're looking off to the side, and so it's hard. Are you talking to me?
Oh, sorry. So you can't, I know. Here's
What
the
movie?
camera.
Yeah.
Oh,
So what movie
and
is
I'm looking
that?
at,
Are you
so
talking?
George, are you ready to, we're checking on David. We know he's here and there he is. So when you're ready, we can get started.
I am ready to call the group back together. We will reconvene. And our first agenda item is dual language. And Camille, would you care to set that up?
Yes, so we're excited to bring you an update on our dual language learner pilot and where we are, especially with the expansion phase and what's going on there. So David Dodds is going to kick it off, and I think Debbie Silverman is going to come in on a portion of this and help him. So David, take it away.
Yes, thank you, Camille. So good afternoon, commissioners. So I'm pleased to introduce this DLL pilot agenda item. So a little over a year ago, we provided you an update about the DLL pilot study, and now we'd like to give you this new update. Some new commissioners have joined us. So first, I'd like to summarize the origins and the purpose of the DLL pilot study. Then I will introduce researchers from the American Institutes for Research who will provide details about their recent findings and their upcoming work. As background, the pilot emerged from the 2014 strategic plan. That plan was based on input from many stakeholders and identified the needs of dual language learners and early learning and care as a key priority. So since 2014, First 5 California staff have also received advice from an input group of DLL experts, agency leaders, advocacy partners, and others to shape the pilot that is now being implemented. So going back again in time, in July 2016, commissioners approved $20 million in funding for the DLL pilot study. A key point to make is that this is not a traditional pilot. So a traditional pilot is where an investment is made in a new program, followed by an evaluation of that program. Instead, for this particular pilot, we started with a study to identify existing effective strategies in California counties, looking at early learning settings with different kinds of questions, such as how do programs engage families to support their children's language development? How do programs deliver effective professional learning opportunities so that educators and caregivers can effectively support the learning and development of dual language learners? What we found is that some counties have extensive expertise in working with young dual language learners and their families. And you're going to hear more about that. The study also looks at contextual factors, including infrastructure, and so the factors that promote or impede the effectiveness and the scalability of programs. And additionally, a goal of this study is to disseminate that information to programs and policymakers. Also, the study is intended to contribute to gaps in research. So in addition to focusing on preschool and centers, the study is also looking at family child care homes and unlicensed settings, serving infants and toddlers. Also, we are including multiple languages, especially Asian languages such as Cantonese, Mandarin, and Vietnamese, in addition to Spanish. In 2017, First Five California contracted the American Institutes for Research as the pilot evaluator following a competitive bid process. In discussion with us, First Five California, AAR, also recommended a 3-phase study. So in attachment A of your agenda item today, you have a summary of those 3 study phases. So just a quick review, they are the background phase, the in-depth phase, and the expansion phase. So just as a quick summary, the background phase was to identify the range of state and local supports for dual language learners and their families and educators. And the results of that first phase were presented as a report and as a briefing at the Capitol this past February. The second in-depth phase is just wrapping up now. So as part of that phase, so I should say that you just received just a week or so ago on October 15th, a summary of the first results from that phase called the Quick Facts. And I want to thank Commissioners Fitzgerald and Alvarez for their statements that they provided for the press release. That particular brief is based on director interviews about the diversity of children in licensed and unlicensed settings, teacher preparation, and the impact of the COVID-19 pandemic on services for dual language learners. And you'll hear more about that again from AAR. The second phase, again, was designed to help us understand the range and distribution of learning experiences and how those are linked to positive outcomes. And then during this phase, the pandemic started, and so that did affect the study. However, AAR researchers were able to adjust their design to meet some of the conditions of the pandemic. And again, you'll hear about that. Additional reports from the teacher surveys and parent surveys are also forthcoming. So the third expansion phase is what we are working on now, and that is where the participating counties are implementing the dual language learner strategies at a larger scale. So the purpose is to learn what it takes to scale up the effective practices. And you can see in attachment B of your item today, a summary of those strategies. Again, another purpose of this third phase is to provide statewide policy recommendations. So staff are very busy here at First Five California, working on the contracts with the 16 counties for the expansion phase. So we anticipate that counties will start that work this December. At this point, I'd like to also just thank all of the First Five California managers and staff who have worked very hard on this project. They include Debbie Silverman, Lakshmi Grajada, and Robert Dean in evaluation, and also Earl Cardenas Jackson and Eric Meow from our contracts office. This has been a large and complex project. Of course, the AAR team has also worked very hard on this project as well, and that project has been led by Karen Manship, Heather Quick, and Rebecca Berge, as well as other staff people with AAR. So you may hear from some of them today. So now I would like to invite Karen Manship and her colleagues from the American Institutes for Research to describe more about the in-depth phase and the expansion phase, what we've learned and our plans for further evaluation. Thank you.
Thanks, David. And thank you, commissioners, for having us today. Can everyone hear me okay? Yes, thank you. All right, so I'll go ahead and share my screen. And please, somebody let me know if what you're not seeing is the slides with our updates. So we really appreciate the opportunity to share more about what we've been learning from this ambitious study and where we are right now and where we're going. I'm Karen Manship, I'm the project manager, as David mentioned, and also on camera, I believe, is my colleague, Gabby Fain. And Gabby will be leading the expansion phase evaluation, which we'll talk about a little bit more in more detail, as David mentioned. And Heather Quick, our principal investigator, Rebecca Berge, the deputy project manager, and Ileana Broldiak, our lead analyst, are also on the line so we can answer any questions collectively that you all might have for us. So just to set the context, as David mentioned, there are 3 phases to the dual language learner pilot study today. So I just wanted to kind of set the context about where what we're talking about today fits. So we've already conducted the landscape or the background study. So all that data has been collected. It included both interviews with stakeholders and also a survey of licensed programs in the 16 participating counties designed to be representative of the state. And so we've released 2 research briefs from that data, including the quick facts that David mentioned that was released last week. And I will share some of those findings with you today. The second phase, the in-depth study, is the largest part of the study. It's currently in progress. Data collection is completed, as David mentioned, but we're in the process of analyzing data. And the goal of the in-depth study is really to understand the relationship of different practices in instruction, professional development, and family engagement with outcomes for DLLs and their families. So the goal of the landscape and or background study was really to sort of understand the landscape of DLLs experiences in early learning and care. The in-depth study is to look at the relationships and identify promising practices. So we're in the midst of analyzing that data now. And then the third phase, the expansion study, will be launching soon. And this is essentially an implementation evaluation of the activities that counties are choosing to implement in the expansion phase. So they have submitted their applications and outlined some basic details about their activities, and we're going to be gathering more information from those counties. Okay, so for the in-depth study, despite COVID disruptions, we are still working to address the study's research questions with the data that we have. So specifically to address the first research question, which is, you see up at the top left, what strategies for instruction, professional development, and family engagement are used for DLLs? So we have data as planned from that to answer that question from both educator and site director surveys. So those surveys were not interrupted, they were electronic surveys. The second research question aims to identify practices that support positive outcomes for DLLs from different ages, from different language groups, and in different types of early learning and care settings, as David mentioned. And so because of the pandemic and related program closures, we were not able to conduct planned classroom observations in the spring or the second round of child assessments in the spring, but we do have teacher reports of classroom practices as planned. We have parent surveys from 2 time points as planned. And we do have assessment data for over 1,500 children from the fall and winter of 2019-20. So direct assessments of preschoolers were conducted by our team, and those included assessments of executive function, pre-academic skills, including print concepts and math, and also English and home language skills, including in Spanish, Vietnamese, Mandarin, and Cantonese, the 4 study languages. We also have data on infant and toddler language development and overall development through parent and teacher reports. So that also was at 1 time point. We hope to get a second time point, but couldn't reach teachers when the programs were closed. And then we do have parent reports of children's social emotional development and also family engagement at 2 time points as planned. So even though COVID disrupted our spring data collection, we still have a lot of data we were able to collect and are diving into that to address the study research questions. We originally planned to look at the relationship between practices and growth for kids from the first time point to the second time point of assessment. So that's no longer possible because we couldn't get that second time point, but we can still look at the relationship between those teacher reported practices and the assessment data we were able to collect, looking at variation by, for example, length of time that some kids were in the program, the different practices in the different programs, and also controlling for demographic and other characteristics. So there's a lot we can still do. So we also wanted to quickly share our plans for the research briefs that are coming out over the next 8 months. So we're doing a lot of releasing of information between now and the end of the in-depth study in June. So we just published the quick facts last week, which is a short research brief about the characteristics of early learning programs that are serving DLLs across the state. In the next couple of months, we plan to release 2 additional research briefs about professional development policies and supports, and then another about sites' general approaches to supporting DLLs, including topics like teacher-student language match and how common that is, what practices are used in different contexts, and different language models. We're also working on a paper for the field about our challenges in assessing children in non-Spanish languages. So that was something that the study was very ambitious, that the study was trying to do, to include non-Spanish languages and really understand the experiences of all DLLs in the state, given our great language diversity. But there were a lot of challenges in finding appropriate assessments and adapting to that. So we are writing a paper for the field about what we've learned, which we think will add a lot of value. And then finally, we're working on an analysis about the relationship between children's home language skills and English skills and their performance on a math assessment, because we gave that math assessment in both the home language and English. So we think that analysis will identify implications for assessing DLLs. And in case that wasn't enough, next year, we're also planning to release 4 to 6 additional research briefs to address the main research question about the relationship between practices and outcomes for DLLs. And so the specific topics of those briefs will be determined as we continue to dig into the analysis of the data. We might focus on, for example, which practices are most associated with infant and toddler language development, or preschoolers' executive function, or we might highlight practices that seem to be promising in particular contexts, like multilingual classrooms, for example. We also have a final report and final summary research brief planned for June, and we're planning on releasing that not only in English, but also in Spanish and Chinese, which we're really excited about. So I'd like to share a few things that we've learned recently from the study. So first, I'm going to share some findings that were released in the quick facts that came out last week. The data from this brief come from the survey of the representative sample of directors of early learning and care programs, as David mentioned, and this was administered in 2019, pre-COVID. So from that survey, as of late last year, we see that nearly all centers statewide, so an estimated 98% of centers, and most family childcare, about 70%, served at least one DLL. So essentially, we're learning that DLLs are not concentrated all in a few programs with lots of DLLs, but rather they attend many different kinds of early learning sites throughout the state. So sometimes DLLs attend programs with many other DLLs, but sometimes they don't. And so the concentration of DLLs in early learning programs really varies widely. So the average early learning program serving DLLs enrolls about 53% of DLLs. But we see that almost half of DLL serving centers and about a quarter of family childcare homes have low concentration of DLLs, which we defined as 30% or less based on the average proportion of ELs in kindergarten. So there's a lot of variation in terms of the proportion of DLLs in different settings. And we're also learning how common multilingual sites are in California. This is really fascinating to see. These are sites where children enrolled represent more than 2 languages. So here you can see the number of languages by setting, so for all sites and for family childcare and for centers. And so one thing you might notice is this bar over here on the right, which right here. So a full 57% of centers that serve DLLs in California serve a group of children that represent 3 or more languages. So this type of environment certainly changes the kinds of strategies you might use or even could use to support children's language development.
That's an amazing number.
It was amazing to us too. This was really surprising and fascinating for us.
Yes, that's wow.
Yeah, and it really, I mean, when I think about California, I really think about our language diversity. And so I guess it shouldn't surprise us, but it's very interesting to see.
You know, we might want to take that piece of data and turn it into a press release and just say, First Five now knows that 57% of the sites have this or more. That it doesn't have to have a lot of other information, but the media is looking for kind of sound bites, and that is an incredibly powerful piece of information that could be very, very useful as people think about both the challenges and the context we live in. That's a big number.
Yeah, it was. This brief was accompanied by a press release when it was released last week. So I don't know if I don't remember if that piece of data was highlighted, but it certainly could be.
Well, but even if it was highlighted, you can do a totally separate release. We've done a lot of press releases. You can do a totally separate release, just kind of featuring that point and then have a couple other comments about the rest of it. Just to get that out there as a soundbite that gets picked up and And part of, and then there's a good reflected glory on First Five because we were the source of it. But that's an amazing number.
Yeah. Super interesting to watch those classrooms too.
Camille, if you decide you want to publicize that a bit, let me know, and we could help with some stuff, because that's the kind of thing that people are looking for and will quote going forward, because it's such a big number. And if we really believe that's real and our research is really credible, that's a big, good to know.
We'll follow up with David and folks. Good deal.
Thank you. So we also took a first look at how home languages are used in classrooms, in classrooms and also in family child care home environments. And we found that 27% of DLL serving programs overall reported using only English for instruction. Another 9% told us that they use only English in some of their classrooms or with some groups of kids. So that would be, for example, in a center that has multiple classrooms. So a couple of them might be dual immersion classrooms and others might be English only. So the remaining 65% used home language in some way. So sometimes that was a formal dual immersion or other structured program. Sometimes it was more informally. And one of our next research briefs is going to dig into this in more detail to describe how home language is used when and how and in what contexts. We also took a first look at the challenges that were reported by administrators of DLL serving programs. And the challenges they reported were greatest in the area of workforce. So for example, difficulty finding staff who can speak children's home languages, or too little funding available for professional development. 43% reported challenges in finding quality bilingual materials, such as books in home languages. And just over a quarter reported at least one challenge related to community attitudes or parent attitudes. So community attitudes about bilingualism in general, or parent attitudes about the value of their home language. That was less of a challenge. And just to give you a preview of what we'll be releasing in the next research brief on professional development. So we're seeing that directors of most programs reported that even if their staff were required to complete a certain amount of professional development overall, they were really often not required to participate in PD specifically focused on DLLs. But we're seeing some interesting variations by QCC participation and also by program funding source, as well as by concentration of DLLs at the site. So more coming on that topic when we release the next research brief next month. So we do have some little bit of information on the impact of COVID as well. So for another separate but related study, AIR in partnership with Early Edge California conducted another survey of early learning programs about the impact of COVID on their programs. The survey was conducted in June and July of this year. So as of July, we heard from programs about significant financial challenges, including 68% reporting challenges related to financial stability. 58% told us they had had to lay off or furlough staff, and 36 reported pay cuts for staff. And that was especially prevalent in family childcare homes. So because of these program closures and also reduced group size requirements to address public health concerns, there are now fewer children enrolled in early learning programs than prior to the beginning of the pandemic. So that's probably not news, but the magnitude of this really surprised us. We're also seeing that DLLs are disproportionately affected by those program closures and reduced enrollments. So we're seeing an estimated 81% of DLLs are no longer enrolled, or as of July, were no longer enrolled where they were in March. So there's been a lot of turnover. And that's compared to 73% of non-DLLs. So 73% is still a huge number. So there's just been a lot of disruption.
Yep. Huge.
And then on the teacher survey that we completed this summer, we also heard from some teachers some comments about how they've adapted to COVID and what the challenges have been. So this just gives you just kind of a snapshot of some of what we saw. So for example, teachers commented on loss of program income, fears that parents have about bringing their children back, lack of training on the technology they needed to use for distance learning, and lack of technology and other resources needed to continue to support their families. So probably none of that is surprising. It's consistent with anecdotes we hear. But we also have seen that programs have adapted as well as they could. So we have some other comments from teachers. They've really been, some have been able to provide training to staff, and a lot of them have really made efforts to stay in close touch with the families that they served while their programs were closed. So just changing gears, we also wanted to give you an overview, just sort of a high-level overview of our plans for the expansion study evaluation that David mentioned. So AIR is currently working with First Five staff to design an evaluation approach to understand the implementation of county's expansion activities. So some of their activities include plans to train staff on strategies to support DLLs, which we heard from the end of study is definitely a challenge that directors are experiencing. We're also focusing on family engagement activities, book distribution, and other activities. So we want to look at these activities and really kind of discern implications for statewide policy for scaling some of these practices up. So Gabby has been leading this design effort. And so we'll give you a quick overview of the study's emerging plans, and we're happy to answer questions as well. So the first research question in the expansion study is being designed to answer is about implementation. So we plan to understand the factors that are behind successful implementation of county strategies. So specifically, we're focusing on a couple of strategies. County's efforts to build the capacity of early educators to support DLLs, so training and other activities, and then also their family engagement activities, particularly focused on families most in need in their counties. So this will allow the expansion study to better understand some of the challenges and barriers that we've learned about so far in the landscape and the in-depth studies, such as the workforce challenges we heard about, and how they might be addressed. So our focus will be on how these factors that support the success of these activities at the local level can inform statewide policy. The expansion study also will focus on systems change and also questions of sustainability and scalability. So we want to know essentially to what extent and how the DLL expansion projects in each county help to change local systems that serve children and families and providers to support DLLs. What have counties learned about scaling up and sustaining these effective practices to support DLLs, specifically in the context of COVID? These projects are going to be starting this fall. And then what are the implications for a post-COVID landscape? Eventually we'll get past COVID for what we can learn now for that time. And then again, what are the implications of all of these lessons for state policy? And so all of the phases of the DLL pilot study are related. This is kind of a quick illustration of how we think of how they're intertwined. So essentially, we think of the in-depth study, which is the data we're currently analyzing about effective practices, as an effort to identify those promising practices. So it will do so by looking at the relationship between the program practices shown in the middle of the graphic here, such as access to professional development, effective implementation of evidence-based practices, and child and family outcomes shown on the right of the graphic. So the in-depth study's goal is to look at that relationship between program practices and outcomes and identify promising practices. Expansion study's goal is different and broader, but complementary. So it aims to look at how to effectively implement and scale those promising practices by looking at the relationship between system supports, such as the system supports you see here on the left, with the implementation of effective practices at the program level. So our goal is to understand what factors hinder the use of promising practices and what contexts can help facilitate effective implementation.
Do you have a sense from this research that the promising practices really make a difference? I mean, the promising practices and having done them, is the process better and more successful? Is it slightly more successful or is it significantly more successful? That's my first question. I got to follow up, but is there a difference, significant difference, you think, based on the promising practices?
I if I understand your question, I think that that is exactly the question we're trying to address with the analysis we're doing right now of the in-depth study data. So we're really trying to see what's
So that's what we're trying to
associated with
learn.
outcomes for families. Yeah.
So we're trying to learn it, because the reason I was going to say, that's incredibly important information.
Right.
Yeah,
That's what we're working on right now.
And to know which of these things work and how, to what degree they work, is very, very important research to do. And you teeing it up now, but you haven't measured it yet. But this is a very good path to go down. Cool.
Great. I'm glad that feels like the right step. There's a lot we do know from the existing literature, but we're really interested in looking at it in California in the context of different age groups and languages and different settings.
I think, George, one of the things when we started out was also to say, promising practice, yes, but are they scalable and are they implementable at a statewide level?
Yeah, exactly. A, what are they? And then B, how can they be used?
Right. So.
Exactly.
Important work to do.
I think
And
you
if
just
you don't know
summarized
what they
really
are,
well
you
what we're
can't
doing
scale
here.
them. But if you do know what they are, you can make all kinds of decisions. So
Yes.
good research.
Thank you. So the last thing I'll say is just to note that through all of this work, our overarching goal is definitely to inform state policy discussions. So the DLL study team has been closely involved with, or just kind of keeping an eye on, a lot of the discussions and developments involving DLLs in the state. So we participated, for example, in the development of Early Edge's COVID-related policy platform. And overall, we're really focused on providing evidence about policies and practices that are of interest to support DLLs in the state. So with our findings, we anticipate we'll be able to make research-based policy recommendations in a few areas. We should be able to make recommendations about what approaches to instruction and family engagement at the site level seem most promising, what kinds of supports both family childcare homes and centers most need to implement those promising practices, what barriers need to be addressed systemically, and what contextual factors could be supported at the state level to help facilitate the use of practices that we know are supportive of DLLs. So we look forward to continuing to share what we learn with the field and with the state and with the commission. So thank you for your attention. Gabby and I would be happy to answer any questions.
Excellent. Any questions from the commission? This is really, really good work and important. With the number of dual language learners in California is massive. And the opportunity is huge, and the current deficits are massive. And so any learning on this path is good, and learning that's really about effectiveness is even better. So good. Any other commissioners want to speak to that?
This is Myra. I just want to share a little bit of the discussion we had as part of the research committee. Monica and I, with David and Debbie and Camille, engaged in a really important discussion about other benefits associated with dual language learning. In particular, again, given the climate in which we're in around racial injustice, DLL is also associated with positive racial socialization and the building of pride and culture and identity. And it's particularly really important in this time where kids of color are hearing very negative messages and are seeing it from all aspects of television and social media and community conversations. And so really exploring our investments in DLL, not only from an education and learning perspective, but also from a well-being perspective is so important, and why this study is not only impactful for investments in the education side of things, but also in our whole child approach to making sure California kids grow up, in the best way possible.
That's great.
And will we have data that helps us to understand that piece?
Which piece specifically?
What Myra was describing in terms of, I don't know, sort of the scientific, I guess in terms of like self-confidence, in terms of positive perception of yourself all of those
Yeah.
benefits?
Yeah, some of those identity benefits. We do have parent report from the ASQSE. So that's this, which measures social emotional development. And I'm trying to remember the other questions that are on our parent survey, but we definitely have some ways to get at that. I'll have to get back to you with the specifics if you're interested in the specific questions. It's definitely something that's been on our mind in the study design as well.
Okay. Oh, and then I have just a quick one. So I think this is great. Quick one just about the PR. So I know we saw a press release went out, I believe this week. I'm just curious, Camille, it didn't look like it was picked up many places, but I'm just wondering if we're happy about the press. And I don't know what the goal was, but if we want to reach more folks, are we going to push it out more? And then was it shared with legislators? Because I know I heard at the beginning, that's sort of one of the goals of this. So what does the information sharing piece look like at this point?
I don't, I'm not sure about the if this has gone to the legislature. You know, certainly we can follow up and make sure it does go, Shana, to offices. We are working with Golan, our PR firm, as well to take, you know, to take this information and also put it into the mix of what they're doing to push it out to appropriate entities to see if we can get it picked up in a wider scope than we currently have. So that's our strategy, is to use Golan as well as you know, those strategies. So I think it, you know, hopefully as we move along and the study continues and we get more information on best practices and what we're finding out, we'll be able to do that.
If I can just make one small comment, is that every one of the 16 counties is embedding this work in their quality rating and improvement system, their local QRIS, QCC work. And so I know that there was a conversation at one point around equity and QRIS. I think that this can help us to address that conversation. It also, we've got a couple of counties who are on the leading edge of really thinking about how to address diverse classrooms when they're looking at quality, and they're going to be expanding upon that work through this, and we'll have some really important recommendations to share with us. The other thing is that although 16 counties are participating, we're actually reaching about half of the counties in the state because of some of the regionalization of the work that's happening. For example, 3 counties in the Bay Area are actually implementing their work in all eight counties in that Bay Area, in that region. We've got a county up north that's doing their professional development training across the entire region up there. So I wanted to just point out that it's not just limited to the 16. Part of this scalability and sustainability is really taking a look at how to expand practices that the counties have already shown to be effective within their county to other counties, other populations, other languages, other age groups. And so that's what part of what AIR, what Karen was alluding to. The other thing is that we heard in an earlier conversation about the challenge around some providers having technology and have parents getting technology to be able to carry out some of these activities. Well, a significant portion of funding from the counties is actually being spent on providing technology and to providing hotspots for families and getting families together in places where they already congregate, so that and using some of those home bases as places to congregate and educate and inform. And so one of the things that I love about this project is that it really weaves together all of the things that we're focused on and we're funding. It weaves in the Talk, Read, Sing, it weaves in the new parent kit, and it takes those pieces of information and provide families with those tools to use them had they been missing them before. And again, making sure that whatever we're doing is we're taking a look at the infrastructure and the system of sustainability, hence this QRIS focus in every single one of the counties. And we didn't require it, but it was something that they felt was very important. And we also are requiring they spend a portion of their funding to make sure that any family that's involved in this program receives books. Books that are not only language appropriate, but also culturally appropriate.
Wonderful. Wonderful, wonderful.
And they are, and one other thing is we made sure that this is targeting populations that have been underserved before and that are high poverty. So we wanted to try to take a slant on this project to not only recover from COVID, but really press counties to not just choose the low-hanging fruit, but to try to find families who are the most hard-pressed and respond to their needs, particularly during this crisis.
One of the topics later on our agenda is our Washington relationship, what we're going to do with Washington next year and the lobbying efforts. One of the things that works really well in Washington is if we can figure out something that's high value here and take it there and then share it with the right people. I think there's a high likelihood, very high likelihood that there are going to be people, depends on who wins. But if the winning goes one way, I think there's a high likelihood there will be people there who are going to really want to work on childhood, early childhood development things and are going to want, in Medicaid, they're going to want the Medicaid program to be spectacular and successful. And this is a really good set of learnings to take in. And if we sit down with those folks and share it with them as a teaching tool from us to them, that creates friendships and alliances, and that can help create money from them to us. I mean, when we're looking at future funding sources, having the people in CMS doing the Medicaid and the dual learning stuff, thinking that we are good people and should be supported, there's nothing but upside in that agenda. And so to the extent that we can package, the reason I mention that is, the reason if we could package that as early as December and January, for some of the early thinkers in that process, that would be a nice thing. Just think about is there any part of this that we could put together just as a quick learning package and say, these are some things that you might want to incorporate into your thinking going forward. And it's much easier to influence long-term thinking early in the trajectory than late.
Yeah.
So this is really good stuff. Thank you for doing it.
You know, to your point, George, I noticed in the paper, I think it was just yesterday, that there has been an out-migration of immigrant families from California net, and a in-migration of immigrant families in other states.
Huh. Yep.
So that, yeah, or at least a net, you know, much less loss. So what you have is you have a situation where, to your point, in Washington, there are going to be a lot of states who have a need for DLL. It's not us anymore, just us.
50
just us in Texas.
50+%, at least 51%, 50+% of the births in this entire country are going to be Medicaid. It's 56% in California, but it's going to be 51 for the country. And all of those other sites are going to want any learning that we have in this space, and they're going to want to do some collaborative agendas. And depending on which way it goes, there's a high sense of ownership and pride in some of the Obamacare stuff. And the anchor of Obamacare is Medicaid. And that's the thing that expanded the coverage to more people than anything. And there's I think a level of pride to make Medicaid great again. And so the opportunity, I think, might be there. And so we can do some teaching in that space, and that would be a good time. So we're going to be talking in a few minutes about our Washington lobbying. If we can make adding value to their thinking part of that, that will increase the likelihood that we have influence and impact. So just a tee up.
Yeah.
I don't think George, we don't have any public comment on this issue.
All right, then let us move on to the small population county funding augmentation.
Thank you, folks. Thanks, AIR.
Well done, very well done, good stuff. We'll build on it. And that takes us to small population county, small county funding. Are we gonna do that again?
I think that's going to be a decision you all are going to make. So I'm going to
Have we
turn
done
it
that before?
just once or twice. Debbie, you want to take it away?
Thank you, and it's me again. Good afternoon, commissioners. I forgot to introduce myself before. I'm Debbie Silverman, Education Administrator. I oversee various program and evaluation projects with partners here at the agency. I want to call out staff member Sylvia Flores. She is the consultant in charge of small population county funding augmentation, which is a mouthful. So we shorten it as SPCFA. And currently we have 20 counties participating in SPCFA. I hope you had an opportunity to review the report from Child Trends that was attached to this agenda item. It is something that we are so proud of our counties. We got all 20 counties who spent quite a bit of time in interviews with Child Trends team. And we felt that the results were very impressive and told us some very important things about the what small counties need and the importance of small population counties to the families. But what is SPCFA? Because I know some of you are newer to the commission and this is the first time we're bringing such an item to you. So just to refresh your memory on the Act, the Children and Families Act, better known as Prop 10 or the Act we like to call it. It's really intended to be a statewide effort to promote, support, and improve the development of all children from prenatal through 5 years of age. And that's how it's been operating because of SPCFA. The Act apportions the county's share of tobacco tax revenue based on the number of annual births in each county. So for a county as small as Alpine, that's like $4,000 a year to operate and meet the needs of children and families in the county. And in some of the other counties, it's still less than $100,000 a year, which is not enough to do justice to meeting the developmental needs of children. What we learned and why SPCFA evolved is because that statutory funding formula for counties with small populations of births did not provide an adequate funds to fully operate a commission and effective first 5 programs. So beginning in the 1999-2000 year, the State Commission has authorized additional funding for small population counties, enabling every county in California to operate a first 5 county commission in order to make Proposition 10 truly a statewide effort and ensure all children can be served. Today's presentation is an information item designed to bring you up to date on this investment that has changed over the years, but we've been implementing over the past 4 under this current authorization, and how this funding augments what small population counties receive via revenue. Today, you will hear from 3 small population counties and an ED from a very large county, Los Angeles, about the unique and crucial role First Fives in small population counties play in their communities. The current cycle of SPCFA funding ends June 2021. First 5 staff, along with Melissa Stafford-Jones from the association and John Sims, have been meeting with a work group of small population county executive directors for the past several months to discuss next steps and what we want to say to you. These EDs are representative of different experience levels with a county commission, different regions of the state, and different size counties. I'd like to tell you who's on that work group. Those work group members include Nina Machado from Amador, Terry Lane from Calaveras, Angela Glore from Del Norte, Carla Ritz from Lake, Nicole Hinton from Modoc, Molly Desbaye from Mono, excuse me, Karen Potts from Siskiyou. And then the counties, these 7 county EDs requested an 8th member to join them to give not only a large county perspective, but also the first 5 network perspective. And so they asked Kim Belshea. You can't get much bigger than that. So today's presentation is really a result of that work group, and it was spearheaded by Melissa Stafford Jones from the association. And I'm going to turn it over to her in just a second. But what I'd like to tell you is that in January 2021, just want to let you know, full disclosure, that we will be returning to you to request additional funding for small population counties. And at that time, we're going to propose a funding amount and a funding formula, which we're currently developing. Melissa?
Thank you, Debbie. Thank you also for the time to address you on this important topic of the role of small population counties in their communities and how the partnership with First 5 California contributes to their local impact. I have the pleasure of just very quickly introducing today's presenters for this item. But first, I do want to thank, we had some really wonderful partners in developing some of these slides. And that was Child Trends, Molly Desbaye from Mono County, and First 5 California staff, who really worked together on some of these slides to try to bring you a full picture of this work. In terms of our presenters today, Debbie mentioned some of them. We have, let me just scroll here so you can see this. Nina Machado from Amador, Carla Ritz from Lake, Karen Potts from Siskiyou, and Kim Belshea from Los Angeles. So with that, I'm going to turn it over to Nina to begin.
Hello, and thank you for your time. I've been asked to provide an overview regarding the history of the small population county funding, which is a critical contribution that was established to address the structural flaw in the original legislation that impacts our collective ability to ensure we reach children throughout California. I thought I would share a portion of the background of the statute that we review in Amador with our new commissioners to help them understand the intent. So it is the intent of this act to facilitate the creation and implementation of an integrated, comprehensive, and collaborative system of information and services to enhance optimal early childhood development and to ensure that children are ready to enter school. The system should function as a network that promotes accessibility to all information and services from any entry point into the system. It is further the intent of this act to emphasize local decision-making and to provide for greater local flexibility in designing delivery systems. So I've observed over the last 18 years, yes, 18 years, that in most small population counties, the commission is the most effective convener in bringing all partners to the table quickly to respond to issues affecting families with children 0 to 5. And I remember attending my first statewide meeting and hearing several of the original executive directors discuss the important role of getting people to the table, which at that time sometimes included having to buy the table. So I've had the privilege of being First 5 Amador's executive director since March 2002. When I was hired, Amador's first executive director shared with me the oversight in the legislation, which made it impossible for the act to be fully implemented statewide. The formula for distributing funds to counties did not take into consideration birth rates in smaller population counties. So historically, First 5 can only reach its full potential if it operates statewide so that every commission, regardless of size, can meet the legislative requirements and operate programs and develop initiatives for young children and their caregivers at a level proportionate to their size. There are fixed costs for operational expenses and basic program implementation, regardless of birth rates and the number of children and families served. The funding level would be applicable to all costs associated with First 5 operations, which include administrative, program, and evaluation. First 5 California's critical contribution to small population county funding helps provide the the baseline funding needed to allow First Five to have statewide reach to the most underserved children, many of whom live in small population counties, as one of my colleagues will highlight in a few minutes. To be an effective systems change agent, it's imperative that First Five has the appropriate level of staff time to represent children and their families during conversations related to health, education, childcare, safety, and access to services, as well as other decision points throughout the county. An example I thought I'd share: for 2 years, I served as the chair for Amador's Social Service Transportation Advisory Council because of my commission's concerns regarding families' access to vital services. As do many counties, we have isolated areas with no public transportation. Because I participate in many county collaboratives and community conversations, I'm well-versed in other funding sources and strategic plans. And I was able to connect a Mental Health Services Act objective regarding access to services with the gap in public transportation, which resulted in funding for a pilot program for an underserved area in our county. The association and First Five California have agreed over the course of the small population work group negotiations to an equitable and workable graduated formula to rectify the oversight in the legislation and ensure that underserved children in small population counties can experience the positive impacts of the work of First Five. Thank you. And now we have Carla, who's going to move us to the next.
Yes, thank you. Let's see if I can share my video so you can see my shining face. There I am. Hello, everyone.
Hello.
Carla Ritz. I'm the executive director at First Five Lake. It has been my honor to be in this role for almost 4 years now, and I can't think of a better job. I love it. And I'm so privileged to be here today to talk with you about what I love to do and the place I love to do it in. So I'm going to spend the next 5 minutes or so giving you a brief tour of our 20 smallest population counties, or I might call them SPCs from time to time, just to shorten things up. And I want to help you see how we uniquely fit within your shameless goal, as Commissioner Major said earlier, your shameless goal to reach the most underrepresented populations in California. If we want to reach 100% of low-income children in the state, then we have to have a vibrant First Five presence in small population counties. So here we go. By and large, the 20 small population counties are the places in California where the other 38 county residents have driven through, maybe went to on vacation, or have never heard of. But I have to tell you that we're drop dead gorgeous. So that's a little bit of a snapshot of what we look like, and we hope you'll visit us from time to time. Smaller population doesn't necessarily mean a smaller land area, as Mina alluded to. And the fewer people per square mile means cleaner air, wide open spaces, and more than our fair share of small town charm. Every coin, however, has two sides. And these open spaces also mean that travel times for the families that we serve to reach us and for us to reach them can be lengthy, even under ideal weather conditions and road conditions, which are not guaranteed where we live. As I'll touch on later, this reality also negatively impacts the health of our communities. But we do not let distance hold us back. Because of SPCFA, we were able to reach about 60% of the children 0 to 5 in our counties in 2018-19, and a greater proportion of children and families in the most marginalized communities. There's a great deal of diversity, obviously, within California's borders. And while as a state, we're mostly characterized by our state averages, many times our smallest communities, our smallest counties are outliers in ways that are critical to understand as First Five California is striving for equity. As you can see here in this slide, Native Americans make up just 1.9% of the population of California, that small yellow wedge there in the pie. But where we live, in SPCs, they are a much greater share of our people. In Lake County's strategic plan, we call out the culture and involvement of 7 distinct tribal groups within our borders as one of the unique strengths of our community. But we also grapple with the harsh reality that 63.6% of Native American children in Lake County live in poverty. I'm going to try not to get choked up about that. That's something that I work on a daily basis with my colleagues here. 63.6% of our Native American children are living in poverty, which is more than double Lake County's already high average. This is the case in other SPCs as well. And the SPCFA makes sure that we are there to support this important population. As I mentioned earlier, another unique factor of SPCs within California is the reality that for many of us, one of the primary barriers to high quality healthcare is distance. The smaller number of people within our borders means that we don't have the number of patients that our small hospitals would require to be able to justify keeping specialty doctors on staff. So just to make this real for you, when a child is born in Lake County, if they are premature or have any complications, their first gift is a trip on a helicopter over the mountains to UCSF, and all future follow-up appointments will be there as well. But on those frequent return visits, a helicopter won't be an option. And parents with young medically fragile children make the 3.5 to 4 hour one-way drive over mountain switchbacks on a regular basis. And we have programs in place to help with that through SPCFA. One of the results of that reality and other compounding factors is that the 5 counties that are at the very bottom of California's 2020 county health rankings produced by the Robert Wood Johnson Foundation are small population counties, and Lake County is at the very bottom. There are no small population counties in the top 15 healthiest in California. Just want to say that again. There's not a single small population county in California that's in the top 15 healthiest. There's a reason for that. Not only do we have significant challenges in obtaining specialty care, our ability to recruit and hold on to medical professionals that provide preventative care, such as primary care physicians and dentists, is also diminished, leading to higher than average ratios of population to provider. Melissa, you are killing it on the slide advancement. I just have to give you props there. Every time I glance over, you're right on it. We all know that adverse childhood experiences can also play a negative role in lifelong physical and mental health. And the average number of children ages 0 to 17 who had experienced 2 or more ACEs in California between 2016 and 18 was 14.8%. That number, as you can see here, is significantly higher in our small population counties. And one of the documented higher rates of specific childhood adversity in our counties is in the area of child maltreatment, including both neglect and abuse in all its forms. In 2018, 18 out of our 20 smallest population counties had higher than the state average rate of substantiated incidents of child maltreatment. And 7 out of the 10 counties in the state with the highest rates of substantiated child maltreatment were small population counties. This is an issue. Finally, as we know, poverty, poor access to healthcare, and childhood adversity add up to greater risks of poor educational outcomes. And unfortunately, the challenges faced by young children in SPCs are on full display by the time they reach 3rd grade. Last school year, the 5 counties in California with the lowest percentage of 3rd grade students that tested at or above grade level in language arts were small population counties. And 16 out of 20 of us, our 3rd graders tested below average. These types of sobering statistics are the key reasons that First 5 California's ongoing investment in SPCFA is so critical. County Prop 10 allocations alone are not enough to do the important work of First 5 in any county in the state. But in SPCs, we faced disproportionate levels of need with the smallest amount of money to meet those needs. Your added investment in STCFA over the years has been a tangible display of understanding of the disproportionate impacts of ACEs, poverty, low levels of kindergarten readiness, and poor access to healthcare that we face even in our beautiful neighborhoods. But we've been here and we've been doing the work and things are getting better. And those investments have led to some really great outcomes for children and families. And I want to leave you with one of those before I pass the baton on to my colleague, Karen. Small population counties participate in early literacy and book programs, such as Dolly Parton's Imagination Library, Raising a Reader, home visiting programs, and other informal community events. And many counties are using the augmentation funds to support the delivery of these programs. For many children who live in isolated rural areas, participation in these mobile book programs may provide their only regular access to books, which could help close early literacy gaps before kindergarten. In Lake County over the past 3 years, we have increased our capacity to be able to distribute more books to more children. And currently in Lake County, 66% of our children under age 5 are receiving a book every month from the Imagination Library delivered right to their home. We are eager to see the positive impacts of those investments and others on those 3rd grade reading scores in the years to come. I'd like now to hand things over to one of the biggest champions of Imagination Library and First Five that I know, Karen Potts.
Thank you, Carla. Wow. I want to be part of small counties, right? And I'm glad that I am part of small counties. And also part of the First Five Siskiyou Commission, as well as the 59 commissions that support us daily, weekly, and on an ongoing basis. As I was introduced, my name is Karen Potts, and I have the honor and true joy of being the Executive Director for First Five Siskiyou Children and Families Commission for the past 17 years. I'll start my presentation with the following quote from Dr. Sarah Calord. Dr. Calord has worked in Siskiyou County for over 20 years. She's currently the Director of Siskiyou County Health and Human Services and one of our more recent First Five commissioners. Sarah said recently, "I'm inspired by the community and by the power of partnership. First Five Siskiyou has fostered collaboration among community partners to bring programs, resources, and expertise into our community that would never have been possible without the vision and leadership by First Five Siskiyou Children and Families Commission." Sarah's sentiments about fostering collaboration, bringing programs, resources, and expertise into communities is possible thanks to the continued support of small population county augmentation. Thanks to you and your commitment to small population counties. These funds assure that small counties have strong foundation, which becomes the gateway to much needed systems and capacity building efforts in our rural counties. With solid foundation, small counties work hand in hand with county agencies, foundations, schools, nonprofit, service clubs, cities, city councils, special districts, families, communities, and many, many others to provide services for all children and families, but especially the most vulnerable children and hard to reach children in our state. Over the next few slides, I will share details about the critical importance of your investment. Over 69% of augmentation funds are invested in evidence-based and evidence-informed programs. When organizations or systems say it can't be possible to provide evidence-based programs or evidence-supported programs in rural counties, First Five says, yes, they can, and we do. We believe that every family, every child, and every community deserves to benefit from proven services. We're committed, thanks to your support. Thank you. 65% of small population counties currently have 2 or fewer FTEs. As you know, 2 or fewer FTEs. As you know, Proposition 10 administrative requirements are the same whether you're part of the larger counties or state or smaller counties. The requirements are the same across the state. We all are required to have audits, evaluations, strategic plans, and other critical and important mandated tasks. The small population funds assure that we meet the requirements of First Five commissions. As Nina shared, it fixes the structural flaw of the legislation. Thanks to you. As stated previously, funding from First Five California creates solid foundation for collective impact. First Fives are recognized systems leaders, capacity builders, and nimble partners throughout the state and especially small counties. When something is needed in a small county as it relates to children and families, often First Five is tasked to be that resource. Small population counties depend on strong partnerships and braided funding for delivery of services. As quoted by an executive director here, it's difficult to have any kind of programs or services in a county with a single funding source. The braided funding is critical to deliver services throughout our counties. The foundation of diversified funding is built on trust and confidence. You help us build this trust. Your unwavering funding support sustains our capacity and builds solid foundation. Thank you. Together, we have leveraged cash and in-kind funds and demonstrated significant impact on transformative partnership. Small population county augmentation has opened the door to 52 fully funded and 29 partially funded programs, such as evidence-based parenting education classes, programs and services to build protective factors, train community members and staff on the protective factors, offer screenings and early literacy programs, and many, many other supports and services. Small population county augmentation dollars provide the capacity, resources for small counties to lead the system's coordination efforts for initiatives such as quality counts and home visiting systems coordination. We would not be able to leverage those resources that are available through First Five California if we didn't have the foundational dollars of small population county augmentation to sustain solid foundation. Typical state and federal programs don't consistently reach many children in rural communities due to the large geographic nature of these regions. For example, those of you who know Siskiyou County and also know Connecticut, we have something in common. We have we're the size of the state of Connecticut. With only 2,500 0 to 5-year-old children. Access to state and federal family support programs are limited and are typically on the I-5 corridor in rural areas, in our rural area. The structure of rural First Five commissions creates systems to reach hard-to-reach children through community-based investments, such as family resource centers, home visiting programs, and other place-based services. Often, First Five funded sites are trained on supporting families to access federal programs such as CalFresh and other resources. Communities know the needs and cultures of families and are eager and dependable partners with First Fives to support parents, protect children, and assure the greatest level of success in school and in life for every child in our small communities. County agencies, healthcare systems, schools, and other systems depend on First Five partnerships to reach the hard-to-reach families and support the professional development opportunities for staff. Next slide. Marie Caldwell, who was the superintendent of one of the Siskiyou school districts, is one of our partners who shared this quote recently. That our schools depend on the supports of First Five commissions for family engagement, for quality improvement services at local preschools, and for teacher trainings. And in our county, thanks to impact dollars, 3 years ago, we started the first ever county-wide kindergarten readiness assessment. Marie's quote represents many superintendents' feelings about First Five commissions in small counties. Finally, I'd like to end with some thoughts about families. As we know, the work that at the heart of the work that we do are all the families in our counties. And each year we have an independent interview of families who benefit from our local family resource centers. And in this reflection, families' voices are critical to our systems for building efforts. Through our independent evaluation systems, we have invited families to share their perspectives about the community-based services through family resource centers. Thank you for helping us help the families make lifelong friends. And after all, healthy friendships are key to solid foundation. As I end my section, on behalf of all the small counties, children, families, communities, and commissions, we thank you, First Five California Commission, for working with us and supporting us hand in hand with integrity and discipline to serve the most hard to reach and vulnerable children, families, and the communities in our state. It's an honor. Thank you.
Thank you.
Thanks, Karen. And I think I have the unenviable task of batting cleanup to these extraordinary statewide leaders representing our many small population counties. I'm Kim Belche. I'm Executive Director of First Five LA, and it's great to see all of you, and we are grateful for the time. I am both the large county representative, and I also would share I'm a founding member of the state First Five Commission, serving from 1999 to 2004. I'm really proud to have an opportunity to bring the large county perspective to the work of my small population county peers and to speak to my deep appreciation. I want to lead with my deep appreciation for their wisdom, their vision, their passion, their creative entrepreneurial problem-solving orientation that you've heard some terrific examples about just now. They make me a better executive director. They make the network stronger and more effective. And most importantly, they make children and families stronger throughout our diverse counties. I want to join my colleagues as well in expressing our deep appreciation to First Five California, to Camille and Debbie and the team, and to the commissioners to date and at present and to date who've been terrific partners and champions, and very grateful for the State Commission's longstanding commitment to ensuring that the promise of Prop 10 in practice becomes a reality for all of our children, regardless of where those children and families may live. I want to close our presentation to the State Commission by returning briefly to where Nina began, which is indeed where our shared efforts began with enactment of Proposition 10 in 1999, and the very clear statement of intent that Prop 10 was about facilitating an integrated, comprehensive, and collaborative system of information and services to enhance optimal early childhood development and to ensure that all children enter kindergarten ready to succeed and learn. The intent is clear. It's an intent that has drawn me into this field, first at the statewide level and more recently at the county level. It's an intent that speaks to a vibrant, healthy, and learning-ready future for all of our children. And as we have acknowledged from the start, Prop 10 had some imperfections, some flaws. Indeed, in the earliest days of implementation, the State Commission of which I was a part, directly acknowledged the enabling statutes limitations and committed to making Proposition 10 work despite those flaws. The small population county program represents state First Fives recognition back in 1999 in partnership and collaboration with the Association of First Fives that a structural fix was central. And I remember those conversations well, and I remember us recognizing that this fix was needed to ensure that all counties had at least a minimum baseline level of support, particularly the small population counties. It's a structural fix that enables not only that baseline, but enables all counties across our diverse state the opportunity to participate and deliver on the expectations, intent, the promise of Prop 10. And it enables all of our children to realize the benefits of a statewide early childhood development system in order to optimize their development and to be ready to succeed in school and life. Since the inception of Prop 10's implementation, the community of First Fives, First Five California, the Association of First Fives, in all 58 counties have really evolved to and have come to understand the power we have as a network. And that network is indeed powerful and is indeed impactful beyond our individual parts. And those individual parts we've come to recognize have to be strong for that collective impact to be realized for our state's children and families. My small population county partners have spoken very concretely to the differences they are making in and throughout their communities, notwithstanding the scope, complexity, and the challenges that they face locally. With First Five California's essential partnership and support, the small population counties are able to ensure that we have throughout California a statewide infrastructure that recognizes local diversity and the associated community needs and priorities and realities in that diversity. With your support, they're able to play multiple roles: conveners, catalysts, connectors, collaborators, and they do it at the intersection of the early learning, child health, and family support systems that we know are so vital to child and family well-being and success. They're able to leverage and mobilize resources in a way that is just simply extraordinary. And in so doing, extend the reach of resources, of relationships, of experience, well beyond the dollars they receive from any one particular partner. And I want to call out, they offer a really powerful and important, unique advocacy voice in some respects for our young children and families that really enhances our collective impact. Simply put, Prop 10 doesn't work without the small population counties, and the small population counties don't work without the critical contribution of First Five California, one that you've made from the start. So from a large population county perspective, I want to say thank you to the State Commission. With your support, we are together helping to ensure a strong and effective small population county First Fives, which are so essential for child well-being, both within those particular counties and as a part of this larger collective statewide network and efforts. I'm absolutely proud to stand shoulder to shoulder with my small county population peers in this work, and so grateful to be able to be part of a network with First Five California, the association, and all 58 counties. So we appreciate your leadership, your partnership, your support. We have done some excellent work together. I know we have a lot of good work ahead of us. And together, I'm confident that we can make Prop 10 deliver on its promise for the children and families of California, no matter where they live, and to realize a statewide early childhood development system that is worthy of our youngest children and their families. So thank you so much, and I'm eager to hear your thoughts and observations and questions.
Thank you. Thank you all. Let's see, unmute. I'm off mute. Well said. Great programs. Thank you very much for describing them and sharing them with us. Any commissioner comments? It really does create an entire fabric for the state to have First Five everywhere in all the sites. And those sites so desperately need people thinking in a very kind of progressive and enlightened way about the needs of children at each of the counties. So it's quite an amazing thing. And that beautiful set of photographs about the counties all being beautiful was kind of nice as well. I personally forget how beautiful some parts of California are. And it's really a lovely state. So,
So we
any
have
comments, any
Myra,
commissioners?
you have Myra, Jackie, and Shayna, I think, and Chris. Okay,
Oh, great,
everybody.
perfect. All right, let's chat.
Great, thank you. Thank you for the presentations and for the stories that you told and the heart that you bring to this work. It really was incredible. I think we don't hear enough about small counties, and many of us don't have the opportunity to go visit. So I really appreciate getting a slightly more intimate glimpse into your world. So I appreciate that. I want to follow up on the question around demographics and just simply knowing how expensive our urban centers are becoming and have been for quite some time. And the fact that more and more families are having to move out into more rural areas in order to afford what many of us call the American dream, right? Which is buying a house and being able to raise your kids outside and have a backyard. But at the same time, we know in this tough economy, our rural areas are often hit hardest, and they're really hit hard by many of our natural disasters as well. So I'd be curious to hear a bit more about how both the economy and these unforeseen events that are facing our state are piled up on top of what you're facing. And you mentioned the importance of braided funding, which frankly, I think all of us can learn from small counties in order to ensure that that sort of braided funding opportunities is also happening in larger counties. But just the reality and the challenges of smaller rural areas for a state like California, would love to hear any of your thoughts on those questions.
You're talking to all of the speakers?
Yeah.
Yeah.
Whoever wants to take that question, one of the presenters maybe?
Oh, I'll jump in.
Okay.
Good.
We have actually been spared this time around. A few years ago, we weren't, with a fire close to us, which was, I could see the flames from my house down the canyon. So can definitely relate to some of what my fellow EDs are experiencing right now and the challenges that go along with that on top of a pandemic. We didn't have a pandemic at that time. Some of the strategies that we have to do, which probably are not unlike some of the larger counties, but we literally do try and go to the unincorporated areas of the county because families don't have transportation to get in. It's expensive to get into, for instance, Jackson, which is the county seat. I can't provide just all of our services here. We literally have to take the show on the road or families wouldn't be able to participate. We actually created a program in Amador County, and we call it an information dissemination program. And the reason was that we didn't want to fund something and not have anybody attend. And literally, we took flyers, brochures to 100 different places throughout the county, one end of the county to the other, because we know that people receive information not just electronically, but on billboards and things like that. We don't have that. So, you know, I do a radio show once a month, a radio interview. And I would ask people when they would call into our office, where did you hear about that program? And they would say, well, I heard you on the local radio. And then I saw a flyer at the grocery store. And then my mom mentioned that, you know, and so it's a lot of word of mouth. We have to be really creative in the way that we deliver the service, the way that we promote it. But we've gotten pretty good. We've actually gotten pretty good. And we share that with our larger counties, you know, because we can pilot something fast. We can turn something around very fast and actually implement something, make a systems change, try it out, and then it can be, you know, moved to a larger setting. So it's another advantage to small counties.
And I'll add to that. Some of you, this is actually my 30th year working in rural communities in Oregon and in California. And some of you may know that I actually immigrated to the LA area when I was a teenager and lived in LA until after college and moved to Oregon. And one of the unique things that I find in working in rural counties, and especially, I mean, just in the most isolated parts of our state or our states, whether it's California or in Oregon that I've had experiences, there's that power of human capacity, human relationships, and human wealth, human being wealth that you see that is as important and as critical as the funding that comes from the federal dollars or state investments. And so when we have the big fire that we just had in our beautiful town of Happy Camp, where 70 out of the 100 children in the community elementary school lost their homes in Happy Camp. That's about 2 hours from where I live. The community came together before anybody else. You know, those that didn't lose their homes quickly helped the others to come back to their community. When outside systems said, oh, they're fine, they can stay in hotels in Wairika and children can go to school in Wairika, the community and the families came together and said, absolutely not. People mobilized and worked with their local family resource center that's funded, co-funded by First Five, to purchase trailers and to help each other take care of each other's animals, and to be a resource to each other. Our wealth as a society are human beings. And what we see in rural counties is that power of human beings being support to other human beings. I hope that answers the question.
That is a really, really wonderful answer. We are about 1 hour behind our schedule right now. I'm going to have to move us back to the agenda. But that was an absolutely wonderful presentation. And then, are there any other comments or questions before on the small counties? And are there any public comment on the small counties?
You had, George, you had Chris, Jackie, and Shayna, who all had.
Okay, Chris, Jackie, and Shayna, let's do those, and then we will go to the next topic.
Okay. Do we have any?
Thank you.
One of you?
Chris, Jackie, Shayna,
yeah.
One of the above.
Hi, everybody. It's so nice to see Nina and Kim and Carla. Wow, Karen, you've been working so hard for so long. I'm really inspired and really moved by what you've accomplished. And this has been a long-standing challenge, and one that you've met the challenge, and you're asking the commission to partner with you to meet more challenges. I read the report and I understand the issue, and I have a couple of questions that sort of didn't get addressed in either place. So I just assume that you've thought about other ways of doing this, and so I'm going to ask you a little bit about what else might have been proposed that isn't being proposed for background, so we can all understand why you arrived at this conclusion and at this recommendation. So I really have two questions. One is, when 58 counties, 20 are small. We at one point, we even broke the 20 up into micro and small at one point in time, and really viewed that there were really different needs in the very, 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 very smallest of counties versus the less small counties. So maybe Nina could answer that in just a second, because I have one other question about the sort of collaboration or blending administrative costs, hubs. It's been called different things, but getting more into the implementation and the daily administration of a commission. Did you think about ways to streamline and reduce costs associated with running a commission without degrading, the direct service, the importance of your presence, those sorts of things. And I imagine, there's an answer to that, but I don't think we really understand that yet. Because as we invest, we want to make sure every dollar is going as close to a family, if not right to a family as possible. And then my last point is a little bit like Myra's point, which just gets to equity. And I think it would be fair to say that when children in large counties are receiving less per child, because that's how the math works out. So the minimum payments to small counties divided by the number of children under 5 means that those children are getting a bigger investment than a child in Los Angeles, San Diego, Orange, Alameda, etc. And you've arrived at the conclusion that that's okay. And so I just want to understand a little bit more about that. And we all need to understand that, why that makes sense when we're dealing with such scarce resources and families are living so close to the edge. Why we would have a situation that isn't equitable. Okay, so there were 3 questions. Nina, I'd like to hear a little bit about micro versus small, and maybe Kim and others could talk a little bit about this question of equity and economic equity when it comes to first 5. And then last, maybe, I don't know, maybe Karen could talk about that administration and how are you being creative about reducing administrative costs to stretch your resources. Thank you.
Sure.
Okay, several questions were raised. Would any of the speakers care to respond?
I think that one of the reasons that we put up the state and wanted to show actually distance and geographic challenges. I mean, when you look at the map of the state, it looks flat, but it most definitely is not flat going from one of our counties to another. Some of them you actually can't get there during the winter. You literally could not get to another county. I think another thing that we've talked about is the partnerships that you need to build within a county require a lot of time and investment. You have different county structures, just building the relationships. And actually the example that I gave of the transportation, the pilot transportation, public transportation, I'm sorry, program, and connecting it with the Mental Health Services Act. If I was trying to accomplish that across multiple counties, there's no possible way that I would be effective in doing that. There's just not a possible way. One thing that we do, and I'm going to answer part of your other question as well, we do look for opportunities to leverage with each other. Some examples, the home visiting grant, I'm actually going to be the administrator for that, but I'm doing that for, it's Amador, Calaveras, and Tuolumne. We look for opportunities where we can do that. And in some cases, it's just not feasible, it's not efficient, and it's not effective to do that in other situations. But we really do look for opportunities where we can leverage that. I'm in the dental transformation grant with Sacramento County. They invited us in to do that. It was a great way for us to learn from each other and leverage even more resources for our counties. But we do look for those opportunities, but the requirements are still the same. They're still in strategic plan, an annual report, an audit, everything that goes into managing a commission.
Well, and that's actually a question then, not for today, but it would be interesting if First 5 California had a different kind of reporting structure for the small counties, perhaps as part of this motion that would, relieve some of that burden. And I don't know enough to go on about it, but it seems like if what you're saying is part of why you need an ED in every county, part of it is that there's a lot of paperwork associated with being a commission. And so in grant writing and applying for these other opportunities, this is very time consuming, recognize all of that. But the other question I had was, what about the difference between Alpine with 7 live births I think, and Siskiyou or Amador, other counties where there are hundreds of births. They really present such different needs, and yet I think you're asking that the augmentation be the same. So you're not. Okay. So Melissa's shaking her head no. We're scaling based on size.
Yeah, maybe one of the members can share well, we haven't come up with a full proposal for this next round, but in this current, and I think for the most part historically, but certainly the last 4 years, it is a graduating funded structure so that the larger counties do get a lesser amount through the program.
Okay, thank you. All right, and that just leaves the equity question.
Can I also add a few things, Chris, with permission?
Yes, please.
I'll just give one example that really is across our counties and continues to grow our counties. First 5 Siskiyou base funding with small county augmentation is including the small counties augmentation is $500,000. We have been able to leverage a variety of funding sources for an annual budget this last year of $1.25 million. And so what that has allowed us to do is to spread our administrative costs across the diverse funding sources. Those funding sources come from our county, from medical systems, from foundations. But that happens, if you look at our pattern of increased funding for our county and increased partnership, it happened with that consistent foundational support to have that solid base of assuring that we have accountable internal controls, internal systems, and solid foundation to be able to go and leverage the funds and share the cost of administration. Other ways that we work with other small population counties, a perfect example, our audit prices were growing with our existing auditor. We now work with an auditor that works with several First 5 commissions, and that fund was reduced significantly because of this multiple First 5 commissions that use the same auditor. A third example is when we learned, thanks to First 5 California support and all of our friends at First 5 commissions, one of the things that we and many other small population counties are realizing that it's just sometimes it's a little bit too expensive to be part of the county fiscal system, at least for our case, our example. We moved away from the county system and are now an independent commission, and that saved us funds to be able to start the Dolly Parton's Imagination Library and put more books in the hands of more children in our county. And if we were to ask the 21 other First 5 commissions that are part of this augmentation, every single one of us would have different stories of what are we doing to have a reasonable, cost-effective administrative services.
So a quick question then, if the 500,000 is turned into $1.2 million, then the value add equation against LA should be $1.2 million against whatever they get rather than 500. Should get twice as much credit for value add on the equity issue. Just if you actually end up with getting the additional $1.2 million in resources added to your cash flow of the 500,000, which is what I heard at the beginning, which is wonderful. That means that the total value that you're providing is more than
exactly. Oh, and it's much more than
yeah, exactly. It's 500,000 plus $1.2 million.
Exactly.
So if you're looking at equity for LA, you should expect LA to come up with at least $1.2 million more on what they get.
It's just different, right?
I know that part was a joke, but in terms of sheer value, although not entirely, but in terms of sheer value, you're providing $1.2 million additional value for the 500,000, and if you're going to do equity, that needs to be worked into the equation.
I think the equity issue. Yeah.
Go ahead, Kim.
Yeah, the equity issue.
You're the equity. most relevant person, so.
I don't know if I would say that, because I mean, there's equity in the context of the small population counties. There's equity in the context of all of the first five. So, you know, I can speak for one large county. And so a couple of observations I'd share. Number one, since 1999, all 58 counties have been strongly supportive of the small population county program. There is a deep and enduring recognition across the diversity of county commissions about the importance of there being a statewide infrastructure and presence across all 58 counties. Number two, it's a little bit of an apples and oranges. That I think the small population counties have done an amazing job leveraging dollars in their communities. There is clearly a return on that investment. But I would also note that in a county like Los Angeles, you know, arguably, if not inarguably, I think there's more funding sources available for us to be tapping. So I think the leveraging opportunities are very different in the nation state of LA than it is in Siskiyou. Number three, you know, my board has been very supportive of, we make a big investment every year in the state association. That reflects our board's recognition of the benefit to LA of there being a strong 58 county presence through the work of the association. So I'm not really sure we can define equity a number of different ways here, but I just think it's a little bit of an apples and oranges and maybe a kumquat. And I would just say from a large county perspective, we really see terrific value for children and for our collective work as a network by having an infrastructure in every county, as you've been hearing and you all have recognized for years. Yeah. And I also think the big first fives have more of a leveraging opportunity. Certainly in LA is a really powerful example. Finally, at the end of the day, we view our highest and best use as working at the intersection of those systems that shape and influence the life trajectory of families. And so when we think about our contribution to sustainable, scalable impact, it's how do we influence and inform and strengthen systems in partnership with others, not just what individual investment in each child are we able to make.
Well said, good points. And when you're looking at that one issue, I was talking about brand earlier. Part of the brands have great value. Brands show up on balance sheets. I mean, brands are very powerful and useful and literally valuable. The brand of First Five is probably stronger in LA because First Five is in all counties. And so it's actually good for the brand to have that statewide presence and to have it be relevant in each county and to have it be strong enough so that the performance in those small counties doesn't embarrass anyone, that it actually enhances the brand rather than. Anyway, you made excellent.
No, I think that's right, George. And it's also incredibly powerful in engaging policymakers in both administrative policy change and legislative policy change in terms of having that unified voice of urban counties and rural counties. And it does in a very productive way complicate the thinking of our partners and policymakers in Sacramento, because you know everyone cares about kids and they're looking for solutions that work for a diversity of localities, and First Fives are demonstrating our ability to do just that.
Yes, and part of the genius of First Five that I did not appreciate until getting there was how wonderful it is to have the counties and have each of the counties have the commissions named by the relevant local people in charge who are highly credible and trusted in the communities. And so when that entire set of counties and the state go together to the legislature, there's a massive credibility. It's fun. I used to work at the American Hospital Association and their national stuff. And we used to go to Washington with every state, bringing it together, small states, large states, because coming there with everyone was far more effective than just California going alone. And
George,
so this is a little,
sorry.
you know.
We still have Shana, I don't know if you still have something, and Jackie, I think. So.
Okay, good point.
Most of my questions, you know, I really want, oh, I'm sorry, Shana, go on.
That's okay, go ahead.
You know, what I was going to ask, you know, being on program is, I think the dialogue is really good, and I have perspectives on two very different sides. One is that I very much support this. I very much support thinking through how we support these small counties in delivering work to their communities based on the tailored uniqueness of those communities. And so on one side, I asked the question, but I don't want it answered today, is how do we not come back to this when funding is over every time? You know, Kim made the comment that there were flaws in the early sort of thoughts and structure around this. So how do we impact that? I don't know, I'm too new to the commission to speak to that, but is there a way that we can just sort of change the encyclopedia around this and change the infrastructure around what small counties need? On the other end, I also want to say, while I think that you cannot put a name to equity, we have to. We're a public-facing group, and there's something we have to do to be able to define the oranges to the kumquats or whatever. We have to do that in some ways, you know, as sort of a public-facing group. So my question to the commission was going to be, because I'll have an opportunity to dive into this again with programs before we meet it again with the ask, which is, are there other things that you all need staff to think through, terminology, thought that you need them to work with these small counties to bring to us so that in January we can make some decisions? So Shana, that's the only reason I was thinking of going last, was because I know our time is limited, and I just wanted to make sure that we had all of your questions so staff and small counties and Kim have an opportunity to answer those questions for us before the ask comes.
Great point. Shana?
Yeah, so I think along those lines and aligned with some of the comments that Chris shared in terms of leveraging efficiencies, and I know this was called out in the report, right, having potentially contractors who could provide, right, these shared services, whether it's annual reports or evaluations or audit. I mean, for me, having all these executive directors having to do that when you could, you know, have a contractor who may be less expensive being able to provide that service in a common way that has been vetted by the commission is something that I would like to look at and really know sort of what savings could be gained there. So Jackie, I think to your question about what I want to know more about, do we think that we could see a better quality product in terms of all these different reporting functions at a lower cost?
And if you do that, which is a really good idea, if you do that, you should add in the brand value. What is the impact on the brand and the value and the credibility of changing to that new model? Will it cause a deterioration? Will it cause less support? Is there an unintended consequence and price to pay from damaging the brand to possibly save a few dollars, which is a distinct possibility. When you're in the brand business, which I've been for a long time, you always worry about that kind of thing. And so keeping the brand strong is important in that deliberation. Anyway, good, thank you. All right, that does, we are running out of time, so I am going to ask, is there any public comment on that?
I'm sorry, George, I've had my hand up and
I'm sorry, I can't see your hand.
I know you didn't see it, I apologize.
Well, I apologize, I can't see your hand.
Sorry. I'm using the little tiny blue hand that Zoom gives me. It's very hard to see, it's about this big. Anyway. Yeah. Here's my hand. So since this is an opportunity to discuss and deliberate and improve the materials that will eventually come back to the commission for approval, and so this is meant in the spirit of filling out and fleshing out that work, I appreciate you all listening to my questions and answering the questions about administrative efficiency. I think there's lots of creative solutions to that. I hope you'll come up with some of those. And I appreciate that all of the meta analysis around the importance of 58 county commissions. I appreciate that work as well. What I didn't hear as much of, and I really would like to see next time, is the individual child impacts that you're achieving through the augmentation that otherwise you would not. So I heard about leveraging, I heard about brand, I heard about policy power, I heard about political power, and I never heard an answer really about how you're and I know this is a big, I know you have it because you do it in your annual report, I know you do, but I would really love that to be kind of equally weighted in your next proposal to the commission. And then I'll make one last editorial comment. When you say flawed, structurally flawed, don't want to come back to this in the future, I just want to remind everyone, the proposition that the voters of California approved is written this way.
Yeah.
They didn't
Right,
approve
exactly.
anything else. So therefore, we're not, I don't know that it's flawed, it's what the voters approved. And we are now in a position as leaders of this movement to figure out as time, as time goes by, what is the best solution? What is the best approach for keeping everybody together? And it's changed over the years. There isn't, we aren't doing today what we did 20 years ago on this issue. So I want to bring us right back to statute and say, Prop 10 is written this way, and this is what the voters approved. We can't undo that, but we can be creative about solving the problem and keeping all of the good work going. So that's I want to remind us all of that. And, we're grateful for that statute, even if it doesn't do everything we want it to do.
Exactly.
Thank you.
It reminds me a lot of a woman who's being named to the Supreme Court right now. What do you call it when you strict constructionalism, or I forget the term?
Originalism.
Yes.
I'd like to say something.
Yes.
I care very passionately about equity, and in a chapter of my life was, fighting like the Dickens for low-income, mostly immigrant children in LA who did not get as much spent on them by a certain state system as was spent on children elsewhere. So I really do feel the question that Chris has asked, the question that Shana has asked, it's an important question. It's an important question. I strongly support the small counties. And I want to just mention two things that impressed me. In work I've done on K-12 education, I remember I was in a very first deep dive into how education funding works in the state. There were, these numbers kept not working. It was like odd numbers, like, gosh, my God, this one little school district, where is that school district? It's spending, $30,000 per kid, my God. Invariably, these were small counties. Small rural counties have exactly the same profile in their K-12 spending as they do in their early ed. It just takes more money. There's fewer kids, but you still have to have the school, and you still have to, plus there's an incredible transportation expense. And so you think, well, gee, they don't have to live out there. They should all move to the city where it's cheaper. Well, no. I think actually we should think of the people who live in the rural counties as frontline or essential workers. These are rangers, these are fire prevention, these are people who run rural hospitals, they're people who keep tourism alive out there, and that tourism helps the whole state, by the way. They come in through the big airports. We're a family, and they're just more, those kids are just more expensive to serve. And so that's what I would like to say. I hear you, Chris, but that's how I see it.
Good points. And with that, I'm going to ask for public comment. Although on the last point, I used to manage a care system that had 550 clinics, and we needed the same brand everywhere. Every one of those clinics had a head. So some people were in charge of 1,000 employees, some were in charge of 50. but there are some things you just put into every county. All right, Camille, what are you looking
So
at?
no public comment. This is going to come back to you in January with an ask. Thank you so much, commissioners, for the rich conversation, for the questions you've asked. And we look forward to continuing to work with our work group and with the program advisory committee. And we'll see you again in January on this item. So the only thing I will say to not all of you, but to our last few presenters, be quick, be concise, and get it done. So with that, George, let's move on.
Yeah, we have the smokers helpline update. We could probably, I would almost think that one could be moved to another meeting.
Good idea.
Is that so? I'm not disagreeing with you. What you would be that in January you would hear the information plus the ask. They would come together. So we
maybe a 5-minute presentation now. The one thing.
Yeah,
can
I
you
don't think
do it?
I would rather give them some time in January. They can make their report with the ask. And
Does that work to everyone to move it to January?
I think so. I like it.
Everybody okay?
Yes,
Chris?
no. All right, we
Can we
will then
have
move it
like
to
a
the January budget.
What? Myra?
One quick comment, when you get it in January, one of
Hold on,
the,
George. You've
What?
got a couple of commissioners who want to talk. Myra?
oh, okay, let's talk, let's do it.
Sorry if I missed this. So if I'm understanding correctly, we're acting on something in January, and today is the opportunity to learn about it. So can we? I'd like to maybe at least learn about it for 2 minutes, maybe.
Oh, but
Yep,
no, but
great idea.
all right. But Myra, this is my thinking. It's the smokers helpline. It's, you're going to hear about it before, instead of hearing about it today and then voting on it in January, you're going to hear about it in January and vote on it the same day. I mean, it's really closer and it'll stick in your mind better. I don't see why we don't just do it that way.
I was just saying in case we don't want to vote on it. Like in case we are like, go back, like we did, like with the small counties, we gave them feedback and they're going to go back and update it. That's all. I don't know enough about
okay.
the
All right.
If
I
that
see.
one-
Okay.
If
All
that
right.
one is delayed in January, there is nothing about it that's urgent, immediate, time
So there you
limited. It's an ongoing process, and what they're recommending is a continuation of the ongoing process. And actually, if I were staying on the commission, I would be changing that process, because what they end up doing is they do nicotine patches for everybody. And all the nicotine patch does is flip the addiction to a different delivery mechanism. And it doesn't actually, their success, they have a tiny, tiny, tiny success in getting people to stop smoking. But that's a different set of issues.
Right.
I've done that in public health world, and I know that nicotine patches don't get
But
people to stop
you're
smoking.
starting the item and.
But let's move on. You're right, Chris. You are right. Let's move on to the next topic. Unless you want to, Chris, do you want to talk about it?
It's not resolved, Chair. I think you have one commissioner asking for something. You don't have resolution, and you're also presenting on the item. So
Okay,
we
let's.
have to kind of use our process.
Yeah.
Okay, absolutely. If a commissioner would like to talk about it, this is a perfect time to do it.
Jackie has her hand up as well.
I would just recommend, I don't believe this item is going to be as controversial in terms of just needing, that's my guess. But I would also say I would prefer not to do it today. We're running out of time, and I don't want to rush the conversation. I want to give the opportunity for the conversation. So I encourage, that's my suggestion. I really do. If we go with that suggestion, I encourage commissioners to read the information that they provided us today, because it is really a good highlight of what we already discussed in program and education. And they, I think, even edited some things for me and Molly when we were like, what, huh? So I think it's really good, but I do think this is something we could hear about and vote on in the next meeting. And if we can't, we don't vote, but I think that we want to give staff time to present on it.
You also have the PowerPoint slides. I just want you to see that you have the PowerPoint slides that we're going to be presented on as well.
That's helpful.
Okay.
Thank you. Good to go.
Okay.
All right, so what
Okay.
is the will of the group? What would you like to do at this stage?
What I heard and saw nodding about was that we would wait until January, come back, present and vote if the commission felt right to vote at that point.
Okay,
That's what I saw nodding about, and
yeah, you can see everybody and the rest of us can't. So I'm
I
gonna,
still,
would anyone like to say that they weren't nodding and would like us to talk about it now?
I don't see anybody raising their hand to do that, George. I think we can move on.
Let's move on then. Okay, we have a couple more topics. One of them is book distribution and early literacy. And what we have here is a report on some of the things we are doing in that space.
So Erin Doobie is going to be presenting, so we're gonna key her up here, and there she is, maybe.
I'm
Erin
here.
Doobie. There you go. Oh, Sarah.
Okay, well, I am going to give you a brief update on our family book distribution partnership. So as you'll recall, when you approved this funding in May, we highlighted the importance of getting books into households with young children, particularly low-income children, children of color, and those households with no books. So this effort leverages current local programs, both private and public, with existing distribution strategies designed to increase the number of books children have in their home and bring books to children and families who live in counties with no current distribution program. So we have a number of programs that are currently being implemented in the state, including Little by Little, as George mentioned earlier, as well as Raising a Reader, Reach Out and Read, and Dolly Parton's Imagination Library. So we are going to be building upon existing efforts and getting books out to as many families as we can. In terms of Imagination Library, we are doing a partnership with the Dollywood Foundation. As you may recall, the Imagination Library provides a high quality book each month to participating children from birth until they're 5 years old. And we've been really working closely with the Dollywood Foundation. So in addition to using some of this funding to expand Imagination Library, which is happening in 10 counties through this funding, we are also working with them to provide an infusion of books. So books coming through the Imagination Library are vetted and selected by early childhood educators, and they focus on core human values, such as respect, acceptance, consideration, empathy, and love. So for those 36 participating counties who are receiving books directly, the Dollywood Foundation has identified a number of bilingual titles and will be producing and shipping approximately 200,000 bilingual titles throughout the state. And this was really important to many of our counties that we secure bilingual books. And so the Dollywood Foundation has been really generous in providing us a lot of their time. They have a very high-tech, very efficient system. They actually print their own books. They print slightly different versions than what you might find in a bookstore because they print them for shipping, and so the shipping costs are reduced. So we're really excited to be working with them, not only on Imagination Library expansion, but also on obtaining books. So these books are in addition to the tens of thousands of titles we've already procured from Scholastic. And we're also doing an order of Potter the Otter books from First Five Santa Clara, which will also be bilingual. Another piece that we're excited about with this is the special wordless printing of Three Brainy Birds Spreading the Word. So if you'll recall, that is a book that was produced as part of our Talk, Read, Sing campaign. But we are going to be doing a special printing without words in order to capitalize on some of the benefits of wordless books, particularly when children or adults are learning a second language or in multilingual homes. Wordless picture books increase a child's vocabulary by encouraging use of words they might not otherwise use, And those books also promote creativity and imagination by allowing a child to add to the story. So we're really excited that that is moving along. So with all of those books, plus an additional donation of 2,000 books from Lexis, we're estimating getting out nearly 600,000 books to almost 200,000 High Promise families across the state. So that's in the 46 participating counties. And another update that we are thrilled to announce is a partnership with State Superintendent of Public Instruction, Tony Thurmond. As part of this partnership, First 5 California and the California Department of Education will jointly create a tip sheet for families to be packaged with the books for distribution. The tip sheet will be bilingual in English and Spanish and highlight the importance of early literacy and build on the Talk, Read, Sing campaign. So now that we have all of the county applications in, we're working through the numbers to determine how many books we can send to each county, and also planning a webinar to provide counties with additional information regarding participation, answer any questions, give them more details on timeline. And we anticipate that books will begin shipping next month and that shipments will continue over the next few months. We have until June to get those out, and some of the counties have requested that we ship things in multiple shipments because of storage issues, and also because they plan to hand them out over time at a variety of events or through a variety of partners. And so we're going to be working with them to try to meet their needs as best we can. Something else that's recently been brought up to us is that we can actually ship books directly to families through the Dolly Parton Imagination Library in counties where they have permission to ship and they actually have families' addresses. So that is something that I think will help counties out as well. So that's all I have in terms of an update, and I'm happy to answer questions if you have them.
Yeah, just a quick one, and I know we're short on time. I can't remember. So in terms of the 46 participating counties, how were those chosen, and why aren't all counties participating?
The counties applied themselves, and so they had the option to opt in. There are a couple of larger counties that already have book programs. Los Angeles is one of them, where they're already focused on Little by Little. And so they did not apply. We did hear directly from Napa County, who is dealing with horrific fires right now, and they just didn't feel like they have the bandwidth to be able to distribute books in light of other circumstances. So I think it depends, but this was something that they were able to opt into. We do have most of our counties already participating in some sort of book distribution. So I do believe that all 58 counties will have books that are provided. And we also provided about 66,000 books through the emergency supply shipments. So those counties also did receive books prior to this effort. So definitely books going out, but through this effort, we do have the 46 counties.
Okay, and it's I mean, if it was sort of a bandwidth issue by staff in some of the counties, does connect to the previous or few items before, right, about small county augmentation, and there's just not enough capacity maybe to apply for all of these things, given competing tasks at hand.
Are there other questions?
Any other questions? Any other comments? I'm going to make a quick comment, but
Sarah Neville Morgan, the deputy at Department of Ed, is online representing the superintendent. You'll remember that face from a while ago. Neville Morgan. Hi, Sarah.
Hi, everybody. Good to see you.
Hello.
You're a little bit
good to see everyone. So good. We were also Commissioner. Is it coming back on?
Yep.
Yeah.
I may have to take myself off video. It's the student issue.
I think that might help, Sarah.
Okay, I'll take myself off video.
Okay.
Okay, I'm competing for bandwidth with a 10th grader who's taking a math test, so.
Perfect.
Okay, hopefully this works. I'll see if people moved. It looks like Commissioner Halverson is moving. So on behalf of State Superintendent of Public Instruction, Tony Thurmond, I want to thank you for the opportunity to partner on an exciting initiative to expand reading opportunities for households with small children. This effort will not only put books in the hands of families and children, but the bilingual tip sheet the CDE will be jointly producing and packaging as part of these deliveries will give families and caregivers tools at their fingertips to strengthen their roles as their child's first teachers. As you know, the timing of this initiative is especially urgent as our families struggle with the disruption of this pandemic, and we must use every strategy available to keep students learning critical of their development. As you also may know, early literacy has been a priority and passion area for our state superintendent. Last year,
We lost you, Sarah.
State development. Is it not
You're back.
working?
Nope, you're back.
Okay. Goodness, maybe I should go tell Anissa to stop taking her math test, that I have a priority assignment. But last year we got a $37.5 million federal grant that really brings, and this will help leverage the statewide existing infrastructure. First Five California is a partner in that grant, and we thank them for being part of our state literacy team in those efforts. But all of this and this initiative will help us reach underserved populations. As we know, starting early means that when they reach the K-12 system, they're much more ready to succeed and really thrive in their literacy efforts. So we look forward to the next steps in our partnership with First Five. And on behalf of State Superintendent Thurmond, thank you again for this opportunity to team up on behalf of our children and families.
Thank you, Sarah.
Great.
Okay, we have no other public comment, George.
All right, I'm going to make a really quick comment about books. When we had lunch, I stopped off and talked with my wife for a second, and she said, "What's on the agenda for the afternoon?" And I said, "The third item is books." And she said, "George, they have all heard you over and over and over again. Could you at least do the short version this time?" So I'm going to do the short version, and you owe that to my wife. Quick comment. We know that we have massive learning gaps in California. We know that we can't change them unless we get support to the kids. We know that brain development in the first 3 years makes a huge difference. We know that the families that have books, studies show that the kids in the homes that are not read to hear fewer than 5,000 spoken words by age 5. The families that are read to hear 200 to 300,000 spoken words, way more if they read a lot, but just reading daily gets to 300,000 words. And so that creates the brain development in the channel. We know from good research that we've had presented to the commission a couple of times that the Hispanic numbers in California, massive Hispanic learning gaps. We know that the average Hispanic child is 4 months behind by age 4 and stays behind for life. And we know that when you look at the learning readiness, only 30% of the homes without books are learning ready, and 60% of the homes with books are learning ready. That's the same family, same education, same dual language, everything. The difference was the Hispanic homes with books had kids who were learning ready and the ones without. So we need books in those homes. I think it's a huge ethical issue, racial issue, and equity issue. And it's hard to really argue that Black Lives Matter when we don't have any books in the home of the majority of the Black children at that age. So with that, I'm just saying, please, please, please support this program, support the other programs, and do anything you can do to get books to those kids. And if we had the books on the COVID homes, right, and right now, the COVID homes, there's isolation and tension and all kinds of challenges. And that can be mitigated by having books in those homes. So that's my quick summary message. And you owe the fact that it's that brief to my wife, and she would actually enjoy a thank you note if anybody sent it to her. So I'll end with that. This is really good work. We're moving in some right directions, and both the superintendent and the state librarian are very, very supportive of this agenda. And I'll end with, if we had a literacy program for California, everybody would join it. Everybody would join it. Everybody would be on board with that. They would come forward and support it and create a different culture for everybody by doing it. And Camila's smiling because she knows that I'm going past the 5. All right, let's move on. Any public comment on this topic? Any other commission comment? Okay, hearing none, let us move on to a fascinating final topic, and that is state and federal budget and legislative update. And as I mentioned earlier, next year, COVID is going to go on. We're going to have an administration, either administration or Washington is going to have to deal with it. They're going to make all kinds of decisions that are going to be relevant to California, and we're going to want to do the very best job we can, both at the legislature and in Washington. So with that as the background, turn it over to Alexandra. Take it away.
Thank you, George. Good afternoon, commissioners. Nice to see you all. Given the time and that we want to make sure we leave enough of it to give George a proper send-off, I am going to keep my comments brief and focus them on the federal RFP portion of the item. Your item does contain a recap of the 2019-20 legislative session, as well as a federal policy update, which we're happy to answer questions about today or offline. So as we prepare for what will likely be an active year in DC, First 5 California is getting ready to release a federal advocacy RFP in the coming weeks. As you'll recall, over the last year, we've had a few conversations with the commission about our growing federal advocacy engagement and this RFP specifically. First 5 LA currently holds a federal advocacy contract that First 5 California and the First 5 Association are beneficiaries of, to ensure that when we show up in DC, we're showing up together. As First 5 LA's contract winds down at the end of this year, the First 5 Network saw an opportunity to look at how we've been showing up in Washington and expand our capacity to have a stronger First 5 voice in DC. As we've had these conversations, it became clear that it didn't make a whole lot of sense for a specific county to be the holder of the contract. And collectively, we decided it was the best fit for the state agency to hold the contract on behalf of the network. So as you'll remember, we brought this idea to the commission last year with a 3-year, $450,000 ask. The commission said yes, and what would it look like if we do more? So a few ideas were raised, including First 5 California funding some national organizations to give First 5s a seat at some broader national tables. So after that discussion with the commission, we went back and did some research, talking with a few DC-based organizations, as well as our First 5 partners. And we came to the conclusion that while there are some new and exciting ways we can engage in DC, until we establish a deeper foundation for First 5's work there, we can't effectively leverage these other pieces, like a funding of the First 5 Years Fund or similar coalition building efforts. So it's a great phase 2 goal, but we need to do the groundwork first to make an additional investment worthwhile. So at the guidance of the Legislative Advisory Committee, we are moving forward with a 3-year, $450,000 RFP, which for reference is about 3 times as large as First 5 LA's current federal lobbying contract. So with this additional funding, we're significantly expanding the breadth of the scope of work to include policy development, lobbying and support for state coalitions, as well as expanded resources to support and coordinate with the state administration. As we get this contract in place and gain our footing in DC, staff will begin to develop a proposal for a phase 2 federal advocacy investment, which will likely run concurrently with the lobbying contract, with the goal of bringing the proposal to the commission for approval in 2021. So we're timing the release of this first RFP so services begin when First 5 LA's contract ends, but we'll be sure to keep the commission apprised of the timeline for this contract as well as a phase 2 expanded services proposal. So I know that was a lot and very quick, so I will stop there and I'm happy to answer any questions that you have.
Excellent. Any comments or questions? Washington's going to make a lot of decisions next year, and they're going to be in a really interesting situation because if they keep doing recovery packages and spending huge amounts of money, they're not going to have any money. That's almost been an infinitely deep pocket because they basically have been printing money with through the Federal Reserve to get through these recoveries, and there's going to be a point when they come to the end of that, and COVID's not going to be gone yet, and so we're going to have to make some decisions. And having an impact on Washington, it's going to be good to have friends there thinking about these sets of issues. And back to the point I made earlier, if we can teach them what to do with the Medicaid population, if we know that the kids who can read are half as likely to have childhood asthma. So, I mean, they're looking at Medicaid issues for the country. And if we help steer them down a path that helps them with that, that's also a good thing. So, any other comments? Any public comment?
Nope, no public comment, George.
No public comment. All right.
So George, now you have to stop.
The agenda?
Yeah, but you have to stop for a moment now. At the beginning of the day, you'll recall you said we were going to save anything we all had to say till the end. So we have been...
that looks like my wife right behind me.
That does. And she has been a good partner to me over the last few weeks. And so... So George, before you open that, put that down for a moment. Put it down. Don't open it yet.
Put it down, put it down.
Okay.
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 By
So
the way,
George,
would you tell her that I did tell the entire commission that she told me to be brief?
yes.
Okay.
So, hi Lori, thanks for helping us. So George, we originally thought this was going to happen at the beginning of the day and planned accordingly. And then of course you changed our mind. So, but we have put together, there are some friends who wanted to say a few things to you. And so we put together a bit of a slideshow that we wanted Lori to see as well. But it starts out with "Good morning, George," and that's me talking. So that was the original intent. But sit back for a few minutes and watch your colleagues and friends have something to say. Good morning, George. We wanted to start this meeting with just taking a couple of minutes to reflect and share some memories of things that have happened over the last 8 years. But first of all, on behalf of all of First 5 California staff, we want to say thank you. Thank you for your leadership over the last 8 years. We appreciate and are grateful for the time you shared with us, your commitment to First 5 California, most of all your commitment to young children and their families. It's been quite a ride, George. We have learned from you. We have taken risks with you. And as you have always asked me or told me, we had fun with you. So again, so grateful for that time. So this morning, some friends have wanted to share a few thoughts with you and do a little bit of remembering.
So right now, I hope you and Lori will sit back and enjoy this little show we put together, and that it will help you to just reflect for a few minutes on all the good things that we've gotten done. Thanks so much, George. Here we go.
When Governor Brown asked for a recommendation about who to chair the First Five California Commission without reservation and immediately, I responded, George Halverson, if we can get him. I have enjoyed and appreciated working with George over nearly 20 years, first at Kaiser and then as the first chair of our Let's Get Healthy California work earlier this decade, and then, of course, through the work at First Five California. His steadfast commitment to health and to the citizens, and mostly to children, and his extensive work in brain research and very early, even pre-birth investments in children is really without measure. He will be a great loss, but the work that he has done at First Five California will go on long after his leadership. So, George, thank you so much for your friendship, for your leadership, and for the passion of your service.
George, congratulations on the amazing accomplishments of leadership of First Five California for so many years. I thank you. On behalf of the children and families of California, you have just been an amazing leader in respects to talk, read, sing, getting books in the hands of all children. I will continue to support that during my time as commissioner. You have also been an incredible leader to me. I have appreciated from day one you sharing your words, your experiences, all of those things. I'm sure my fellow commissioners will join me in saying we will continue to embrace your thoughts and your energy as we lead this commission and the work for children and families of California. Much success in all you do.
Hey, George, what happened, man? You know, as you leave First Five, I'm reminded of the test that's often applied, whether it's in sports or business or other enterprises, about people that have been enormously successful once. They've won a championship. They've begun a startup. They've built an entity. People do that once. The question is, can they do it again? Can they do it again after that? That's the reason we look at how many championships can a team win, for example. And what's so interesting is that I know that you've made a difference. You won a championship at least 3 times that I know about. So the first was with Kaiser. When you took it from an entity that was, had a lot of problems, a lot of criticisms, to an entity that has become a standard of care worldwide. And then with your books that have provided such direction for social and healthcare policy. And then the area where I've respected your work so much, which your leadership of State First Five. And you know, what's so interesting in that is, we didn't always agree. And when we didn't, of course, I was right and you were wrong. But leaving that aside, it was the way that you handled discussion and disagreement with such respect, and how you learned from what each point of view was that was expressed, I think, is part of the secret for your success. And so I know that you've won 3 championships. You've had an enormous positive impact on the world at least 3 times. And now what I expect as you go on to the next stage of your life is that you're going to do it a 4th time. And I look forward to learning in what area that occurs. So an honor and a pleasure to have worked with you, and good luck for the next step.
Congratulations, George. Erin Gable here. And
First, I want to thank you on behalf of California's babies for the incredible work and leadership that you have shown, taking First Five California to a totally different level, and really just taking the message of what it means to invest in the early years in such simple terms, taking that to the next level with all of our state leadership. And I know you won't stop, even though you're retiring from the commission. I will plan on that. And then personally, I want to thank you just for everything that you taught me and encouraged me to do and to be. You taught me to be relentless. You taught me the power of focus and the power of just being a dog with a bone when it's the right bone. So anyway, thank you very, very much, and good luck with everything. Please stay in touch.
Hey, George, what a privilege to be with you on this important event and day. Thank you for your incredible leadership and vision. 8 years running the state's First Five Commission. Just grateful for your incredible work and your dedication to young people and families across our state. Your focus on health and education, in particular literacy, have made an important difference to so many Californians. And as you move into the next stage and focus, I know our emails and exchanges and conversations that you'll continue to nudge us all in the right direction so that we can keep young people in mind and focus on all of the wonderful principles in a California for all. So George, enjoy this day and event and good luck with the next phase. Thanks again.
Hi, George. Thank you so much for your leadership as chair of the First Five California Commission. I had the honor of being sworn in just over a year ago under your leadership. And in that time, I'm grateful for the conversations that we've shared, your incredible commitment to our young children, and your call to action to all of us to always do more. This has been a learning journey for me and for all of us, and I've appreciated your willingness to continually grow and learn more about how we as a commission can better serve California's young children and their families, especially those most marginalized. Given the many roles you have had in your professional career and the countless ways you have advanced policy for the well-being of families, I wish you all the best, and I look forward to continuing to fight the good fight alongside you, just only from a different role. Take care.
Hello, George. What is First Five going to do without you? Over the years that you've been chair, you've nurtured hundreds of children and their families, and we're all the better for it. The first clue that we were in for a different kind of chair was your very first meeting. You were greeted by a large group of protesters, as I recall. I think that you're the only chair to have received that kind of welcome. But seriously, over the years that I was fortunate to serve as a commissioner alongside you, I saw how your vision and leadership inspired all of us, the staff, the other commissioners, and the other stakeholders, inspired all of us to strive to achieve even higher accomplishments than before. And this was even in the lean years. I want to wish you well in your next endeavor. Whatever it is you choose will benefit greatly from your tremendous talents and compassion. And I want to thank you for your outstanding public service to California.
George, thank you. Thank you for being chair of First Five California for 8 years, supporting the staff, the commission, the administration, the whole state, all the parents and families who are benefiting from the great work that has happened here over these many years. It's been actually a kind of a tough 8 years in many ways for the state of California, but one of the bright spots has been First Five California, and thank you for the leadership and the intentionality and the focus on what's best for kids during your tenure. All the best.
Hey, George. I just wanted to drop you a line to thank you for all the work you did for us at First Five California. We really had some good times, and I have some very fond memories of the work that we did. I'll always remember your passion and your great work ethic. So thank you for that. And I definitely appreciate your unwavering confidence in my ability to drive us from one place to another. We always got there, maybe a little late. We got there all the same. So thank you for that. And thank you for everything you've done. Good luck in your future endeavors. And as a wise man once said, be well.
Hi, George. It's Shayna. It has been just a pleasure to work with you over the years on First Five to advance our shared priorities to lift up and support families all across California. I've learned so much from you about the impact of the first days and weeks of life on the health, wellness, and academic outcomes of our children. And I wish you all the best in all of the great work I know you'll continue to do, and hope we can continue working together in the future.
Dear George, I can't believe this is your last commission meeting. I still remember my first one. You shared the importance of children accessing books. Your passion made our commission meeting very lively. Also, thank you for your support of the Success of Talk, Read, Sing campaign. This campaign has data to show that parents' behaviors changed based on the ad. This is a legacy that you will leave First Five California. On a personal note, do you remember when Commissioner Jim, you and I attended the Governor Brown farewell celebrations? We devised a plan for me to be introduced to the governor. After numerous attempts, we were unsuccessful, but luckily we didn't get arrested. And most importantly, we didn't need to call Camille to bail all three of us out. I think there might be some photos somewhere. I've always admired how dedicated you are to address the opportunity gap and ensure that our families of color and their children reach their full potential. George, we are indebted to you for your contribution to ensuring that all California children and their families thrive. Much gratitude, my friend.
Greetings, George. I want to add my voice too. How can we thank you enough for all you've done for the children of California? Because you and I share an appreciation for that beautiful water-rich state, Minnesota, let me thank you first of all for having been willing to be away from that lovely place and away from your family so often and for such long stretches in order to be with us here. It cannot have been easy, but you did it with great generosity and good cheer. Thank you. Thank you too for always urging us to be accountable and transparent in our work for and with First Five. We will always hear your voice in our heads telling us to set clear goals and then keep good track of how well we're doing in achieving them. It sounds like an easy thing to do, but it's not. It's hard. So thank you for reminding us how important it is. And finally, George, let me thank you for always being so uncomplaining and stalwart, regardless. Your whole life, you have been a voice for intercultural peace and understanding, for reaching across divisions to form common bonds and common belief and progress. Thank you for always being able to maintain that value, even when what we've had to say to you has sometimes been hard for you to hear. It takes a big guy to do that, George, and you've been one. You've earned our admiration and our affection. So, bon voyage, safe travels, and don't be a stranger. We will miss you very much.
Hi, it's Governor Gavin Newsom, and I'm here to lend my voice of thanks to our friend George for nearly 8 years of outstanding service as the chair of the First Five Commission here in our state. So many families and kids in our state have benefited from George's skill, his experience, and commitment to those crucial early years. He's brought decades of experience as a leader in the medical field to this commission, understanding at deepest level the importance of the first few days, weeks, and months, not just years, of a young child's life. And all along the way, he's forged unlikely partnerships with other sectors and inspired others to match his commitment and his resolve. Passionate about early literacy and early brain development, George was one of the architects of our hugely impactful Talk, Read, Sing campaign. He showed us about how talking, reading, and singing with our little ones quite literally grows and builds their brains. We're grateful to George for educating all of us about the millions and billions of neuron connections happening each and every time a loving parent opens up a book and reads with their child. And George has convinced so many of a fundamental truth. In order to close the achievement gap, we must first eliminate the opportunity gap and give all California children the best possible start in life. George, I just want to personally thank you for your incredible partnership, your faith and devotion to the cause of building a generation, and for all of your incredible work on these early childhood efforts. You are simply irreplaceable. You won't only be missed. And I just want you to know that we count on you. And we look forward to continuing to collaborate with you on these critical issues and so many more, because not just for you, but because our kids deserve your insight, your talent, and I know this, with your support and with that insight, the best is yet to come.
Wow.
There you go, George. So now you can look at the box. So open your box. Thank you, Lori. So really, on behalf of all of us, George, this is just something to remember us by. And so when you look at it, you'll think of us.
Oh, wow. Look at that.
Oh, nice. Here, it goes in. Oh, I guess it came unglued.
It stands up.
It stands up. It stands up.
It came unglued, I think.
Oh, no.
There's not a groove there. We'll have to.
It broke.
No, it just
No, it came unglued. It came unglued. It is unglued, and this is not the first time I've been unglued. So
we will. We'll figure that out, George. How to fix it?
Oh, that'll be.
We can fix
it. We can figure it out.
Okay.
Wow.
Anyway.
That's beautiful.
Yeah, it is. Really nice.
That is really lovely. Thank you.
And it says what we all know, George: talk, read, sing.
So,
exactly.
So with that, we just want to again say thank you for everything, and thank you to all the commissioners and everyone who participated in that video. So I think with that, sir, you just need to adjourn this meeting. And
I was going to say, I don't think we're adjourned. Is there a motion to adjourn this meeting? None.
Somebody raise your hand.
Moved.
So moved. Is there a second?
Thank you, Myra.
I second.
Thank you. Moved and seconded. All in favor, say aye.
Aye.
Aye. We are adjourned. Thank you. Thank you. That was wonderful.
George.
Thanks a lot.
Thank you.
You'll have to come back, George. Come back and see
You know
us.
what? The good news is the meetings will be on
Zoom.
on public display on YouTube. So I will probably be on a couple topics. That person who's waiting to be the public, the outside speaker.
Okay. That would be great to see.
I don't guarantee that, but I think I might.
Montu, best of luck to you too. Thank you so
Yes,
much.
and
Well, you know
Montu,
what, everybody, we need intergroup peace right now. We've got to make some decisions as individuals to do the right thing, to get along with each other.
Oh, okay.
After the election, we're going to have to do some peace. So let's do peace after the election.
Yeah. George, so sorry. We have public comment on the video. Renee Fraser is on.
Public comment on the video. Okay.
Muted. You're muted, Renee.
Muted.
There you go.
There she is.
It's Renee
Hey, Renee.
Fraser. I watched that wonderful video. I sat through the entire meeting, and it's always impressive, and I'm always touched by the quality of the work, the quality of the thinking, and the impact all of you are having on our children throughout the state. I obviously wanted to say a few words about Talk, Read, Sing, if you don't mind. I'll be very short. You know, we all are driven to do our best and deliver great work that makes a difference. When we're able to connect our efforts to real behavior changing impact that touches millions of families, we know we've reached a special moment. And I'm humbled to say that we've done that with Talk, Read, Sing. And George, you have helped us achieve that milestone for First 5 California. I'd like to express my respect and gratitude for your leadership of this powerful campaign, your tenacity and your conviction, because you're right, ad agency people want to come up with fresh new ideas. And you kept us on board. As Molly's reiterated, we had a goal and we met it with 90% of people, parents across the state, not only recognizing Talk, Read, Sing, but knowing how to harness the power of these 3 simple words to create a positive lifelong impact for their children. We read it every day in the social media. We truly have changed lives. And I'm so touched by doing that and honored to have been a partner, all of our team in this process. So I'm looking for that next chapter, as everyone said, and looking forward to seeing even more impact, George. Thank you.
We need peace. We need intergroup peace.
We need intergroup peace. That should be the next.
Desperately need intergroup peace in America, and the time is right to do that work. So.
Okay.
We'll be
All good.
listening.
Thank you much.
We'll be watching. And thank you again. Thank you, commissioners, for letting me say these last words. I truly appreciate it. And thank you, George.
All right. Thank you, commissioners. It's been a day.
it certainly has. Thank you, Camille. Thank you, George.
Thank you. That was unexpected, totally unexpected, and lovely, actually. Thank you.
Heartfelt.
All right. Thanks so much, everybody.
Bye-bye.
Bye-bye.
Bye, everyone.
Bye.